Always sort of green. Okay, there we go.
The Subcommittee on Health will now come to order. The chair recognizes herself for 5 minutes for an opening statement. And the first thing that I'd like to say is welcome. Welcome back, the 116th Congress under the new majority. And I want to thank my Democratic colleagues for supporting me to do this work, to chair the subcommittee. It is an enormous honor, and it is what is contained in the committee, of course, are some of the most important issues that the American people expressed at the polls in the midterm elections. To our Republican colleagues, I know that that there are areas where we can really work together. In some areas, we're going to have to stretch. But know that I look forward to working with all of you, and to those that are new members of the subcommittee, welcome to each one of you. I know that you're going to bring great ideas and really be instructive to the rest of us, so welcome to you. As I said, health care was the single most important issue to voters in the midterm elections. And it's a rarity that there would be one issue that would be the top issue in every single congressional district across the country. So this subcommittee is front and center. We're beginning the Health Subcommittee's work by discussing the Texas versus United States lawsuit and its implications for the entire healthcare system, both public and private. For over 100 years, presidents including Teddy Roosevelt, Harry Truman, Richard Nixon, and others attempted to reform our nation's health insurance system and provide access to affordable health insurance for all Americans. In 2010, through the efforts that began in this committee, the Affordable Care Act was signed into law, and bold reforms to our public and private insurance programs were made. Since the Affordable Care Act was signed into law, over 20 million Americans have gained health insurance that is required to cover pre-existing conditions. The law disallows charging sick consumers more. It allows children to stay on their parents' health insurance policy to the age of 26 and provides coverage for preventive health services with no cost sharing. Last February, 20 attorneys general and governors sued the federal government to challenge the constitutionality of that law. They claimed that after the individual mandate was repealed by the Republicans' tax plan, the rest of the Affordable Care Act had to go too. The Trump administration's Department of Justice has refused to defend the Affordable Care Act in court, and in December, Judge Reed O'Connor of the Northern District of Texas declared the entire ACA invalid. 20 attorneys general, led by The Attorney General from California, our former colleague, Javier Becerra, have appealed Judge O'Connor's ruling. For those enrolled in the Affordable Care Act, if the Republican lawsuit is successful, the 13 million Americans who gained health insurance through the Medicaid expansion will lose their health insurance. The 9 million Americans who rely on tax credits to help them afford the insurance plan will no longer be able to afford their insurance. And health insurance costs will skyrocket across the country when healthy people leave the marketplace for what I call junk insurance plans that won't cover them when they get sick. Another implication, leaving the sick and the most expensive patients in the individual market, driving up premiums for so many. The insurance reforms of the ACA protect every American, including those who get their health insurance through their employer. Every insurance plan today is required to cover 10 basic essential health benefits. No longer are there lifetime limits. The 130 million patients with pre-existing conditions cannot be denied coverage or charged more, and women can no longer be charged more because they are females. I'm going to stop here, and I'm going to yield the rest of my time to Mr. Butterfield.
Thank you, Chairwoman Eshoo, for holding this very important hearing on the absolute importance of the Affordable Care Act, and thank you for giving us an opportunity to expose a poorly written Texas case. I want to talk a few seconds about sickle cell disease. More than 1 out of every 370 African Americans born with sickle cell disease, and more than 100,000 Americans have this disease, including many in my state. The disease creates intense pain that patients usually must be hospitalized to receive their care. Without pre-existing condition protections, tens of thousands of Americans with sickle cell could be charged more for insurance. They could be dropped from their plans and be prevented from enrolling in insurance plans altogether. Republicans have tried and tried and tried to repeal the ACA more than 70 times. We in this majority have been sent here to protect the Affordable Care Act. Thank you for the time. I yield back.
I thank the gentleman. Next week, I just want to announce this, our subcommittee is going to explore specific legislation to reverse the administration's actions to expand the skinny plans, the junk insurance plans, and we're also going to discuss legislation that would restore outreach and enrollment funding that's been slashed by the administration so we can ensure that health care is more affordable and accessible for all Americans. We want to thank the witnesses that are here today. Welcome to you. We look forward to hearing your testimony. And now I'd like to recognize Dr. Burgess, the ranking member of the Subcommittee on Health, for 5 minutes for his opening statement.
Thank you, Chairwoman Eshoo. Let me just take a moment to congratulate you. As you are quickly finding out, you now occupy the most important subcommittee chair in the entire United States House of Representatives, and I know this from firsthand experience. We were the most active subcommittee in the United States House of Representatives last Congress. Hundreds of hours in hearings on health policy, and certainly look forward to that continuing through this term as well. I want to thank our witnesses all for joining us this morning. We are here to discuss the issue of protecting access to health care for individuals with pre-existing medical conditions, in addition to the Texas versus Azar case. So I think you heard the President say this last night in the State of the Union address. There is broad bipartisan support for providing protections for patients with pre-existing conditions. I'm glad we're holding our first hearing of the year. It is the end of the first week of February, so it is high time that we do this. It's unfortunate we're having a hearing that actually doesn't move toward the development of any policies that actually would improve health care for Americans. To that effect, there are numerous options that you could bring before us that could moot the Texas versus Azar case, but subcommittee apparently has chosen not to do so. For example, the bill to repeal the individual mandate is one that I've introduced previously. You could join me on that effort, and if the individual mandate were repealed, the case would probably not exist. You could reestablish the tax in the individual mandate, which would certainly be your right to do so. And again, that would remove most of the argument for the court case as it exists today. You know, I hear from constituents in North Texas concerned about not having access to affordable health care. In the district that I represent, because of the phenomenon known as silver loading, as benchmark silver plans, premiums continue to increase. Well, if you're getting a subsidy, what me worry, no problem, I got a subsidy, so I'm doing okay. But in the district that I represent, a school teacher and a policeman couple with 2 children are going to be covered in the individual market, and they're going to be outside the subsidy window. So they buy a bronze plan because, like everybody, they buy on price, so that's the least expensive thing that's available to them. And then they're scared to death that they'll have to use it because the deductible is so high. You get a kidney stone in the middle of the night, and guess what? That $4,500 emergency room bill is all yours. So I take meetings with families who are suffering from high health care and prescription drug costs, and unfortunately, we're not doing anything to address that today. We could be using this time to discuss something to develop policies to help those individuals and families. But again, we're discussing something upon which we all agree, but we're taking no substantive action to address. Look, if you believe in Medicare for all, if you believe in a single-payer, government-run, one-size-fits-all health system, let's have a hearing right here in this subcommittee. We are the authorizing committee. That is our job. Instead, we have the House Budget Committee holding those hearings, and Democrats on that committee are introducing legislation. But these bills belong in the jurisdiction of the Energy and Commerce Committee, and yet we've not scheduled a hearing to discuss this agenda. Do I agree with the policy or think it would be a good idea for the American people to have Medicare for all or one-size-fits-all health plan? No, I do not. And I would gladly engage in a meaningful dialogue about what such a policy would mean for the American people. Single-payer health care would be another failed attempt at a one-size-fits-all approach. Americans are all different, and a universal health care plan that does not meet the varying needs of each and every individual at different stages of their life will probably not be successful. Today, we should be focusing on the parts of the health insurance market that are working for Americans. 71% of Americans are satisfied with employer-sponsored health insurance, which provides robust protections for individuals with pre-existing conditions. Quite simply, the success of employer-sponsored insurance markets, it's not worth wiping that out with a single-payer health care policy, yet the bill that was introduced last term, that's exactly what it did. But today, there are a greater percentage of Americans in employer health coverage than at any time since the year 2000. Since President Trump took office, the number of Americans in employer health coverage has increased by over 2.5 million. Given that the United States economy added more than 300,000 jobs in January, the number of individuals and families covered by employer-sponsored plans is likely even greater still. Instead of building upon the success of our existing health insurance framework, radical single-payer government-run Medicare would tear it down. It would eliminate the employer-sponsored health insurance, private health insurance, Indian health insurance, and make inroads against taking away the VA. Again, I appreciate that we've organized and we're holding our first hearing. I believe we could be using our time much more productively. There is bipartisan support for protecting patients with pre-existing conditions, and I certainly look forward to hearing the testimony of our witnesses. Thank you. I yield back.
I thank the ranking member, and let me just add a few points. You raised the issue of employer-sponsored health care. Our employer is the federal government, and we are covered by the Affordable Care Act. Number two, we on our side support universal coverage. And but what the committee is going to be taking up is, and you pointed out, some of the chinks in the armor of the Affordable Care Act. We want to strengthen it. What you described relative to your constituents certainly applies to many of us on our side as well. So we plan to examine that, and we will.
Will the gentlelady yield on the point on employer coverage for members of Congress? I actually rejected the special deal that members of Congress got several years ago when we were required to take insurance under the Affordable Care Act, and we all were required to join the DC exchange, but we were given a large tax-free monthly subsidy to walk into that exchange. I thought that was illegal under the law. I did not take that. I bought a bronze plan, an unsubsidized bronze plan, healthcare.gov, most miserable experience I've ever been through in my life. And just like constituents in my district, I was scared to use my health insurance because the deductible was so high. I yield back.
I thank the gentleman. It would be interesting to see how many members have accepted the ACA, they and their families being covered by it. Now I'd like to recognize the chairman of the full committee, Mr. Pallone, who requested that this hearing be the first one to be taken up by the subcommittee on Texas, the Texas law case, and I call on the gentleman to make his statement. Good morning to you.
Thank you.
You just shut it off.
I did.
There you go.
Thank you, Madam Chair, and thank you for all you've done over the years to help people get health insurance, to expand insurance, to address the price of prescription drugs and so many other things, and is glad to see you in the chair of this subcommittee hearing. Now, I was going to try to be nice today, but after I listened to Mr. Burgess, I can't be. You know, and I'm sure he's going to see this as personal, but I don't mean it that way. But I just have to speak out, Mr. Burgess. Look, you were the chairman of this subcommittee the whole time that the Republicans tried unsuccessfully to repeal the Affordable Care Act. I have had so many meetings where I saw you come in and take out your copy of the hearings on the Affordable Care Act and repeatedly tell us that the Affordable Care Act was bad law, terrible law, it needs to be repealed. I saw no effort at all in the time that you were the chairman to try to work towards solutions and improving the Affordable Care Act. What I saw were constant efforts to join with President Trump to sabotage it. And the reason that this hearing is important, because the ultimate sabotage would be to have the courts rule that the ACA is unconstitutional, which is totally bogus. You found this, right-wing judge somewhere in Texas. I love the state of Texas, but I don't know where you found him. And and you did forum shopping to find him. And we know his opinion's going to be overturned, but we still had to join a suit to say that his opinion was wrong and it wasn't based in any facts or any real analysis of the Constitution. And the reason we're having this hearing today is because we need to make the point that the Republicans are still trying to repeal the Affordable Care Act. They're not looking to work with us to improve it. There were many opportunities when the senators, Senator Lamar Alexander and others, were trying to do things to improve the Affordable Care Act, to deal with the cost sharing that was thrown out by the president, to deal with reinsurance, to make the market more competitive. And at no point was that brought up in this subcommittee under your leadership. You talk about the employer-sponsored system. Sure, we all agree 60% of the people get their insurance through the employer. But those anti-discrimination provisions that you said are protected with employer-sponsored plans, they came through actions of the Democrats in the Affordable Care Act that said that you could not discriminate, that you could not discriminate for pre-existing conditions, that you had to have an essential benefit package. Those are a consequence of the ACA. So don't tell us that somehow that appeared miraculously in the private insurance market. That is not true at all. Talk about Medicaid expansion. Your state and so many other Republican states blocked Medicaid expansion. So there's so many people now that could have insurance that don't because they refuse to do it for ideological reasons. You mentioned the Indian Health Service. I love the fact that the gentleman from Oklahoma had that Indian Health Care Task Force. Thank you. I appreciate that. But I asked so many times in this subcommittee to have a hearing on the Indian Health Care Improvement Act, which again was in the Affordable Care Act, otherwise it would never have passed, and that never happened. We'll do that. But talk about the Indian Health Service. You did nothing to improve the Indian Health Service. I'm not suggesting that wasn't true for the gentleman of Oklahoma. He was very sympathetic. But in general, we did not have the hearing, and we would not have had the Indian Health Service Improvement Act but for the ACA. And finally, Medicare for all. Who are you kidding? You're saying to us that you want to repeal the ACA, and then you want to have a hearing on Medicare for all. You send me a letter asking for a hearing on Medicare for all. When does a member of Congress, let alone the chairman or the ranking member, I guess in this case, ask for a hearing on something that they oppose? I asked for hearings on things that I wanted to happen, like climate change and addressing climate change. I don't ask for hearings on things that I oppose. I get a letter saying, oh, we should have a hearing on Medicare for all, but by the way, we're totally opposed to it. It's a terrible idea. It'll destroy the country. Oh, sure. We'll have a hearing on something that you think is going to destroy the country. Now, don't get me wrong. We will address that issue. I'm not suggesting we shouldn't. But the cynicism of it all, the cynicism of coming here and suggesting that somehow you have solutions, you have no solutions. I'm more than willing to work with you. I'm sure the chairman, Eshu, is willing to as well. But don't tell us that you had solutions. You did not, and you continue not to have solutions. And I'm sorry to begin the day this way, but I have no choice after what you said. I mean, it's just not, it's just, it's disingenuous. Thank you, Madam Chairwoman.
Thank you. And now I'll recognize the ranking member of, good morning.
Good morning.
The ranking member of the full committee, my friend, Mr. Walden.
Thank you, Madam Chair, and congratulations on taking over
very
this
much.
subcommittee.
I appreciate it.
I always enjoyed working with you on the telecommunications issues, and I know you'll do a fine job leading this subcommittee.
Thank you.
So we look forward to working with you. I cannot help but respond a bit. I do wish we were meeting to pass bipartisan legislation to protect Americans with pre-existing health conditions from losing their coverage given the pending court case. And let me speak on behalf of Republicans because we fully support protecting Americans with pre-existing conditions. We've said this repeatedly, we've acted accordingly, and we mean it completely. We could and should inject certainty into the system by passing legislation to protect those with pre-existing conditions, period. On the opening day of the 116th Congress, House Republicans brought a powerful but simple measure to the floor that called on this body to legislate on what we all agree needs to be done, and that is to lock in protections for patients with pre-existing conditions. Unfortunately, that went down on a party line vote. Our amendment was consistent with our long-held views with respect to the American Health Care Act, which our Democratic colleagues, frankly, in some cases continued to misrepresent. We provided protections for those with pre-existing conditions under the HCA. Insurance companies were prohibited from denying or not renewing coverage due to a pre-existing condition, period. Insurance companies were banned from rescinding coverage based on a pre-existing condition, period. Insurance companies were banned from excluding benefits based on a pre-existing condition, period. Insurance companies were prevented from raising premiums on individuals with pre-existing conditions who maintain continuous coverage, period. The fact is, this is something we all agree on, and we should and could work together to expeditiously guarantee pre-existing condition protections for all Americans and do so in a manner that can withstand judicial scrutiny. That's something I think we could find common ground on. And while a status check on the ACA lawsuit is interesting and important, the ruling has been stayed. The attorneys general across the country have filed appeals. Speaker Pelosi has moved to intervene in the case, I think, 3 times, and Americans' premiums and coverage for this year are not affected. But what really does affect American consumers is out-of-control costs of health care. That's what they would like Congress to focus on, and something I think we need to tackle as well. The fact of the matter is that for too many Americans, health insurance coverage exists solely on paper because health care costs and these new high deductibles are putting family budgets in peril. When the Affordable Care Act passed, Democrats promised people their insurance premiums would go down $2,500. Unfortunately, the exact opposite has occurred for many Americans, and not only have premiums gone up, not down, but think of what out-of-pocket costs have done. They've skyrocketed. The latest solution from my friends on the other side of the aisle is some sort of Medicare for all proposal. And yes, we did ask for a hearing on it because I think it's something that Democrats ran on, believe in fully, and we should take time to understand it. We know this plan would take away private health insurance from more than 150 million Americans. We're told it would end Medicare as we know it, and it would rack up more than $32 trillion in costs, not to mention delays in accessing health services. So, Madam Chairwoman, other committees in this body have announced plans to have hearings on Medicare for all. Speaker Pelosi has said she is supportive of holding hearings on this plan. And Madam Chairwoman, I think I read you yourself said such hearings would be important to have. A majority of House Democrats supported Medicare for all in the last Congress. In fact, 2/3 of the committee, Democrats, 20 members, 11 of whom are on this subcommittee, have co-sponsored the plan. I think it's important for the American people to fully understand what this huge new government intervention to health care means for consumers if it were to become law. Yesterday, Dr. Burgess and I did send you and Chairman Pallone a letter asking for a hearing on Medicare for all. And we think, as the Committee of Primary Jurisdiction, that just makes sense. So as you're organizing your agenda for the future, we thought it was important to put that on it. The American people need to fully understand how Medicare for all is not Medicare at all, but actually just government-run single-payer health care. They need to know about the $32 trillion price tag for such a plan and how you pay for it. They need to know that it ends employer-sponsored health care, at least some versions of it do, forcing the 158 million Americans who get their health insurance through their job or through their union into a one-size-fits-all government-run plan. So if you like waiting in line at the DMV, wait until the government completely takes over health care. Seniors need to fully understand how this plan will affect the Medicare trust fund that they've paid into their entire lives and the impacts on access to their care. Our tribes need to understand how this plan could impact the Indian Health Service, and our veterans deserve to know how this plan could pave the way to closing VA health services. So the question is, when will we see the bill, and when we'll have a hearing on the legislation? Meanwhile, we need to work together to help states stabilize health markets damaged by the ACA. Cut out-of-pocket costs, promote access to preventive services, encourage participation in private health insurance, and increase the number of options available through the market. And I want to thank Mr. Pallone for raising the issue involving Senator Lamar Alexander. He and I and Susan Collins worked very well together to try and come up with a plan we could move through to deal with some of these issues. Unfortunately, we could not get that done. So let's work together to lock in pre-existing condition protections. Let's tackle the ever-rising health care costs and help our states offer consumers more affordable health insurance. And if you are going to move forward on a Medicare for All plan, we'd like to make sure we have a hearing on it before the bill moves forward. So that, Madam Chair, thank you and congratulations again. I yield back.
I thank the ranking member of the full committee for his remarks. Several parts of it I don't agree with, but I thank him nonetheless. Now we'll go to the witnesses and their opening statements. We'll start from the left to Kristen Link Young, a fellow, USC Brookings Schaefer Initiative for Health Policy. Welcome to you. And you have 5 minutes. And I think you know what the lights mean. The green light will be on, then the yellow light comes on, which means 1 minute left, and then the red light. So I'd like all the witnesses to stick to that so that we can get to your questions, our questions of you, expert as you are. So welcome to each one of you, and thank you, and you are recognized.
Good morning. Thank you. Thank you, Chairwoman Eshoo.
Get a little closer to the microphone. Thank you.
How's that? Good morning, Chairwoman Eshoo, Ranking Member Burgess, members of the committee. Thank you for the opportunity to testify today. I am Kristen Link Young, a fellow with the USC Brookings Schaefer Initiative on Health Policy. My testimony today reflects my personal views. The Affordable Care Act has brought health coverage to millions of Americans. Since the law was passed, the uninsured rate has been cut nearly in half. The ACA's marketplaces are functioning well and offering millions of people comprehensive insurance.
Do you have the, excuse me, do you have the button pushed? Is it on, the microphone?
Looks like it.
Maybe bring it a little closer.
Is that any better?
That's better.
Great.
Thank you.
Wonderful. 37 states have expanded Medicaid, and many of the remaining states are considering expansion proposals. Beyond its core coverage provisions, the ACA has become interwoven with the American healthcare system. As just a few examples, the law put in place new consumer protections in employer-provided insurance, closed Medicare's prescription drug donut hole, changed Medicare reimbursement policies, reauthorized the Indian Health Service, authorized biosimilar drugs, and even required employers to provide space for nursing mothers. One of the core goals of the ACA was to provide health care for Americans with pre-existing conditions, and I'd like to spend a few minutes discussing how the law achieves that objective. By some estimates, as many as half of non-elderly Americans have a pre-existing condition, and the protections the law offers to this group cannot be accomplished in a single provision or legislative proclamation. Instead, it requires a variety of interlocking and complementary reforms threaded throughout the law. At the center are three critical reforms. Consumers have a right to buy and renew a policy regardless of their health needs, have that policy cover needed care, and be charged the same price. Further, the ACA prohibits lifetime limits on care received and requires most insurers to cap copays and deductibles. Crucially, the law ensures that insurance for the healthy and insurance for the sick are part of a single risk pool, and it provides financial assistance tied to income to help make insurance affordable. However, a recent lawsuit threatens this system of protections. In Texas v. United States, a group of states argue that changes made to the ACA's individual mandate in 2017 render that provision unconstitutional. Therefore, they puzzlingly argue that the entire ACA should be invalidated, stripping away protections for people with pre-existing conditions and everything else in the law. The Trump administration's Department of Justice has agreed with the claim of a constitutional deficiency, and they further agree that central pillars of the pre-existing condition protection should be eliminated. But unlike the states, DOJ argues that the weakened remainder of the law should be left to stand. Other scholars can discuss the weakness of this legal argument. I'd like to discuss its impacts on the healthcare system. DOJ's position that the law's core protections for people with pre-existing conditions should be removed would leave Americans with health needs without a reliable way to access coverage in the individual market. Insurers would be able to deny coverage and charge more based on health status. In many ways, the market would look like it did before the ACA. Components of the law would formally remain in place, but it is unclear how some of those provisions would continue to work. The state's position would wreak even greater havoc and fully return us to the markets that predated the ACA. In addition to removing central protections for those with pre-existing conditions, the financial assistance for families purchasing coverage and the ACA's funding for Medicaid expansion would disappear. The Congressional Budget Office has estimated that repeal of the ACA would result in as many as 24 million additional uninsured Americans, and similar results could be expected here. In addition, consumer protections for employer-based coverage would be eliminated, changes to Medicare would be undone, the Indian Health Service would not be reauthorized, the FDA couldn't approve biosimilar drugs. Indeed, these are just some of the many and far-reaching effects of eliminating a law that is deeply integrated into our healthcare system. Before I close, I would like to briefly note that Texas v. United States is not the only recent development that threatens Americans with pre-existing conditions. Recent policy actions by the Trump administration also attempt to change the law in ways that undermine the ACA. As just a few examples, guidance under Section 1332 of the ACA purports to let states weaken protections for those with health needs. Nationwide, efforts to promote short-term coverage and association health plans seek to give healthy people options not available to the sick and drive up costs for those with healthcare needs. Additionally, new waivers in the Medicaid program allow states to place administrative burdens in front of those trying to access care. To summarize, the Affordable Care Act has resulted in significant coverage gains and meaningful protections for people with pre-existing conditions. Texas v. US threatens those advances and could take us back to the pre-ACA individual market, where a person's health status was a barrier to coverage and care. The lawsuit would also damage other healthcare policies, and this litigation coincides with administrative attempts to undermine the ACA's protections for people with pre-existing conditions. Thank you.
Thank you very much. Next, Mr. Avik Roy, the president of the Foundation for Research and Equal Opportunity. Welcome.
Chairwoman Eshoo, Ranking Member Burgess, and members of the Health Subcommittee of the House Energy and Commerce Committee, thanks for inviting me to speak with you today. I'm Avik Roy, and I'm the president of the Foundation for Research on Equal Opportunity, a nonpartisan nonprofit think tank focused on expanding economic opportunity to those who least have it. When we launched in 2016, our first white paper showed how universal coverage, done the right way, can advance both progressive and conservative values at the same time, expanding access while reducing federal spending and burdensome regulations. In my oral remarks, I'm going to focus on a core problem that, respectfully, Congress has failed to solve: how to protect Americans with pre-existing conditions while also ensuring that every American has access to affordable health insurance. 32 million U.S. residents go without coverage today. Fewer than half of those eligible for subsidies in the ACA exchanges have enrolled in ACA-based coverage. This failure is the result of the flawed theory, first articulated by MIT economist Jonathan Gruber, underlying Title I of the Affordable Care Act, that if Congress requires that insurers offer coverage to those with pre-existing conditions, and if Congress forces insurers to overcharge the healthy to undercharge the sick, Congress must also enact an individual mandate to prevent people from jumping in and out of the insurance market. We should all know by now that Professor Gruber is not omniscient. After all, in 2009, Gruber said, "What we know for sure about the ACA is that it will, quote, lower the cost of buying non-group health insurance." In reality, premiums have more than doubled in the ACA's first 4 years, and the ACA's subsidies only offset those increases for those with incomes near the poverty line. There are two flaws with Gruber's theory, sometimes called the three-legged stool theory. First, the two ACA provisions that have had the largest impact on premiums have nothing to do with pre-existing conditions. Second, the ACA's individual mandate was so weak, with so many loopholes, that its impact on the market was negligible. Guaranteeing offers of coverage for those with pre-existing conditions has no impact on premiums because the ACA limits the enrollment period for guaranteed issue plans to 6 weeks in the fall or winter. The limited enrollment period, not the mandate, ensures that people can't game the system by dropping in and out. While community rating by health status does cause some adverse selection by overcharging healthy people who buy coverage, thereby discouraging healthy people from signing up, among enrollees of the same age, this is not an actuarially significant problem. The largest impact is from the ACA's 3-to-1 age bands, which on their own double the cost of insurance for Americans in their 20s and 30s, forcing many to drop out of the market because younger people consume 1/6 of the health care that older people do. In the court cases consolidated as NFIB v. Sebelius, President Obama's Solicitor General, Neil Katyal, repeatedly argued that if the individual mandate were ruled to be unconstitutional, much of the ACA should remain, but that the ACA's guaranteed issue and health status community rating provisions, the ones that impact those with pre-existing conditions, should also be struck from the law. The Trump Justice Department has merely echoed this belief. Both administrations are more correct than the district judge in Texas v. Azar, who in an egregious case of judicial activism argued that the entirety of the ACA was inseverable from the mandate. However, it is clear that both justice departments are also wrong. The zeroing out of the mandate penalty has not blown up the insurance market. Indeed, it has had no effect. To be clear, it's not just ACA enthusiasts who have bought into Gruber's flawed theories. Many conservatives have as well. A number of conservative think tank scholars have argued that because they oppose the individual mandate, we should also repeal the ACA's protections for those with pre-existing conditions, that is, guaranteed issue and community rating by health status. These scholars have argued that a better way to cover those with pre-existing conditions is to place them in a separate insurance pool for high-risk individuals. I want to state this very clearly. Those scholars are wrong. The most market-based approach for covering those with pre-existing conditions is not to repeal the ACA's guaranteed issue and health status provisions, but to preserve them and to integrate the principles of a high-risk pool into a single insurance market through reinsurance. I've been pleased to see Republicans in Congress support legislation that would ensure the continuity of pre-existing condition protections irrespective of the legal outcome in Texas v. U.S. I hope both parties can work together to achieve this. Both parties can further improve the affordability of individual insurance by enacting a robust program of reinsurance and restoring 5-to-1 age bands. On these and other matters, I look forward to working with all members of this committee, both today and in the future, to ensure that no American is forced into bankruptcy by high medical bills. Thank you.
Thank you very much, Mr. Roy. You've testified here before, and we appreciate your being here again today. I would like to just suggest that for the benefit of members, that you get your testimony to us much earlier. All right?
I apologize. I was, of course, officially invited to testify before this committee on Monday. I had some personal and professional obligations that limited my ability to get the testimony in a timely fashion.
Yeah.
I will be happy to brief any members of this committee or their staffs.
Well, we thank you. I have a bad habit. I read everything, and it wasn't there. So, but I heard today, and then we'll all ask you our questions. Thank you. The next witness is Ms. Hung, and she is the co-founder of Little Lobbyists. You're recognized for 5 minutes, and welcome.
Thank you. Good morning. Thank you, Chairwoman, Ranking Member, and members of this subcommittee for the opportunity to tell my story and share my concerns with you today. My name is Elena Hung, and I am a mom. I'm a proud mom of an amazing 4-year-old. My daughter, Xiomara, is a happy child. She is kind and smart and funny and a little bit naughty. She is the greatest joy of my life. She's at home right now getting ready to go to school. She attends an inclusive special education pre-K program. And I asked her if she wanted to come here today, and she said she wanted to go to school instead. It's been a long moment, a long road to this moment. Xiomara was born with chronic, complex medical conditions that affect her airway, lungs, heart, and kidneys. She spent the first 5 months of her life in the neonatal intensive care unit. She uses a tracheostomy tube to breathe and a ventilator for additional respiratory support. She relies on a feeding tube for all of her nutrition. She participates in weekly therapies to help her learn how to walk and talk, but I am thrilled to tell you that Xiomara is thriving today. This past year was her best year yet, health-wise, and ironically, it was also when her access to health care has been the most threatened. I sit before you today because families like mine, families with medically complex children, are terrified of what this lawsuit may mean for our kids. You see, our lives are already filled with uncertainty. Uncertainty about diagnoses, uncertainty about the effects of medications and the outcomes of surgeries. The one certainty we have is the Affordable Care Act and the health care coverage protection it provides. We don't know what Xiomara's future holds, but with the ACA's protections in place, we know this. We know Xiomara's 10 pre-existing conditions would be covered without penalty, even if we switched insurance plans or employers. We know a ban on lifetime caps means that insurance companies cannot decide that her life isn't worth the cost and cut her off care just because she met some arbitrary dollar amount. We know we won't have to worry about losing our home as a result of an unexpected hospitalization or emergency. We know Medicaid will provide the therapies and long-term services and supports that enable her independence. I sit before you today on behalf of families like mine who fear that the only certainty we know could be taken away pending the outcome of this lawsuit that seeks to eliminate protections for people with pre-existing conditions. And if that happens, our children's lives will then depend on Congress, where every so-called replacement plan proposed over the last 2 years has offered far less protection for our kids than the ACA does. I sit here before you today on behalf of Isaac Crawley, who lost his insurance in 2010 after he met his lifetime limit just a few weeks after his first birthday, but got it back after the ACA became law. Micah Eilers, who was born with a pre-existing congenital heart defect and was able to obtain health insurance again when her dad reopened his own business after being laid off. Timmy Morrison, who spends part of his childhood in hospitals, both inpatient and outpatient, because his insurance plan covers what is essential to his care. Claire Smith, who has a personal care attendant and is able to live at home with her family and be included in her community thanks to Medicaid. Simon Hatcher, who needs daily medications to prevent life-threatening seizures, medications which would cost over $6,000 a month without insurance. Colton Preifogel, who passed away on Sunday and was able to spend his final days pain-free, with dignity, surrounded by love because of the hospice care he received. These are my friends that I love. These are Xiomara's friends. This is our life. I co-founded The Little Lobbyists, this group of families with medically complex children, some of whom are here today, because these are stories that desperately need to be told and heard alongside the data and numbers and policy analysis. There are children like Xiomara in every state. That's millions of children with pre-existing conditions and disabilities across the country. I sit before you today on the eve of another trip to the Children's Hospital. Tomorrow, I will hold my daughter's hand as I walk her to the OR for her procedure. And as I've done every time before, I know I will drown in worry as a mother does. But the thing that has always given me comfort is knowing that my government believes my daughter's life has value and that the cost of medical care she needs to survive and thrive should not financially bankrupt us. It is my plea for that to always be true. Thank you.
Thank you, Elena. Beautiful testimony. Beautiful testimony. I wish Xiomara were here. Maybe we can provide a tape so that when she gets older, she can hear her mother's testimony in the Congress of the United States. Thank you. I now would like to recognize Mr. Thomas Miller, Resident Fellow at the American Enterprise Institute. Welcome and thank you.
Thank
you
you,
have 5
Chair.
minutes.
Thank you, Chairwoman Eshoo. The mortifying silence C in my written testimony in your name must have been due to the speed with which I delivered the testimony on time, but I apologize for that. Thank you also, Ranking Member Burgess and members of the subcommittee. Now let's all take a deep breath and get to it. The Texas case remains in its relatively early stages. Its ultimate fate is much as another 16 months away. The probability of a Supreme Court ruling that would overturn the entire ACA remains very, very low, despite last December's decision at the federal district court level. Any formal enforcement action to carry out that decision has been stayed while the case continues on appeal. We've been here before. Two longer-term trends in health policy persist. Our over-reliance on outsourcing personal health care decisions to third-party political intermediaries, and then our chronic inability to reach compromises and resolve health policy issues through legislative mechanisms. They have fueled a further explosion in extending health policy battles to our courts. So welcome back to Groundhog Day ACA litigation version. The plaintiff's overall case is not frivolous, but it does rely heavily on taking the actual text of the ACA literally, and thereby limiting judicial scrutiny to what the Congress that enacted it appeared on the limited record of that time to intend by what it did. The plaintiffs are attempting to reverse engineer and leverage the unusually contorted Supreme Court opinion of Chief Justice Robertson, NFIB v. Sebelius. Some critics insist that the 115th Congress that zeroed out the mandate tax also expressed a clear intent to retain all other ACA provisions. This ignores the limited scope of what that Congress had power to do through the vehicle of budget reconciliation and the Tax Cutting Jobs Act. All that its members actually voted into law was a change regarding the individual mandate. It did not and could not extend to the ACA's other non-budgetary regulatory provisions, nor did it change the findings of fact still in statutory law first made by the 111th Congress that insisted the individual mandate was essential to the functioning of several other ACA provisions, notably guaranteed issue and adjusted community rating. The plaintiffs are not out of bounds in trying to hold Congress to its past word. It happens once in a while. And in building on the similar reasoning used by other Supreme Court majorities to strike down earlier ACA legal challenges. Since that's the story for ACA defenders, they should have to stick to it, at least until a subsequent Congress actually votes to eliminate or revise those past findings of fact already in permanent law. But even if appellate courts ahead also find some form of constitutional injury in what remains of the ACA's individual mandate as a tax-free regulatory command, the severability stage of such proceedings will become far more uphill for the plaintiffs. Most of the time, the primary test is functionality in the sense of ascertaining how much of the remaining law would the Congress enacting it believe could be retained and still operate as it envisioned. Given the murkiness of divining or rewriting legislative intent in harder cases like this one, it remains all but certain that an ultimate Supreme Court ruling would at a minimum follow previous inclinations revealed in the 2012 and 2015 ACA challenges and try to save as much of the law as possible. Even appellate judges in the Fifth Circuit will note carefully the passage of time, the substantial embedded reliance costs, and the sheer administrative and political complexity of unwinding even a handful of ACA provisions on short notice. So don't bet on more than a narrow finding that could sever whatever remains of an unconstitutional individual mandate without much remaining practical impact from the rest of the law. On the health policy front, we might try to remember that when congressional action produces a flawed legislative product, justified in large part by mistaken premises and misrepresentations, it won't work well. The ACA's architects and proponents oversold the effectiveness and attractiveness of the individual mandate, claiming it could hold the law's insurance coverage provisions together while keeping official budgetary costs and coverage estimates within the bounds of CBO's scoring. But what worked to launch the ACA and keep it viable in theory and politics did not work well in practice. And to be blunt, one of the primary ways that the Obama administration sold its proposals for health policy overhaul was to exaggerate the size, scope, and nature of the potential population facing coverage problems due to pre-existing health conditions. Of course, public policy should address remaining problems. It could and should be improved in other less prescriptive and more transparent ways than the ACA attempted. My written testimony suggests a number of options available to lawmakers if some of the ACA's current overbroad regulatory provisions were stricken down in court in the near future. However, we're not back in 2012 or 2010 or even 2017 anymore, at least outside of our court system. Changes in popular expectations and health industry practices since 2010 are substantial breaks on even well-structured proposals for serious reform, but that's where the real work needs to be restarted. It's often said with apocryphal attribution that God takes care of children, drunks, or fools in the United States of America. But let's not press our luck to produce better lawsuits, fewer lawsuits. Let's try to write and enact better laws. Thank you.
Thank you. And now, our last witness, Mr. Thomas Miller, resident fellow. I'm sorry, Mr. Simon Lazarus.
Now we're even.
Constitutional.
Well, he's younger than I am.
Constitutional lawyer and writer. Welcome. It's lovely to see you, and thank you for being here to be a witness and be instructive to us. You have 5 minutes.
Thank you, Chair Eshoo and Ranking Member Burgess and members of the subcommittee. My name is Simon Lazarus. I'm a lawyer and writer on constitutional and legal issues relating to, among other things, the ACA. I've had the privilege of testifying before this subcommittee and other congressional committees numerous times. I'm currently retired, and the views that I express here are my own and cannot be attributed to any of the organizations for which I previously worked or other organizations. I have to say that I'm not sure how important my task is, because I think all of the witnesses have pretty much agreed with the bottom line, and that includes the witnesses invited by the minority, and that is that this decision to invalidate the entire ACA is in significant respects, and I think many of us agree that in all respects, completely baseless legally, and has close to zero chances of being upheld on appeal. And in light of all of that, Tom, I'm puzzled by your assertion that the lawsuit is not frivolous, because that sounds to me like the definition of frivolousness in a lawsuit. In any event, I think it should be underscored that it's not a coincidence that even the minority witnesses think very little of this lawsuit, because as soon as the decision came down, it was attacked in extremely strong terms across the political spectrum. As the Wall Street Journal editorialized, "Well, no one opposes Obamacare more than we do. Judge O'Connor's decision is likely to be overturned on appeal." Legal experts, including prominent anti-ACA conservatives, have blistered Judge O'Connor's result. For example, Philip Klein, who's the executive editor of the Washington Examiner, called the decision an assault on the rule of law. Professor Jonathan Adler, who is an architect of the second fundamental legal challenge to the ACA, that's King v. Burwell, which I think the idea for which was hatched at a meeting that you probably hosted.
We were there before.
Okay. And that effort to kill the ACA was rejected by the Supreme Court in 2015. In any event, Professor Adler called the decision, quote, an exercise of raw judicial power, unmoored from the relevant doctrines concerning when judges may strike down a whole law because of a single alleged legal infirmity buried within it. And on the courts, if one is going to be a prognosticator, just look at the basic facts. Chief Justice John Roberts' pertinent opinions nearly ensure at least a 5-4 Supreme Court majority to reverse Judge O'Connor. And moreover, it should be noted that Justice Brett Kavanaugh, looking at his prior decisions as a D.C. Circuit judge, also looks very likely to join a larger majority to reverse Judge O'Connor. So my job here is just to try to explain what the legal reasons are for this negative judgment on O'Connor's decision. So I'm going to try to briefly do that. To begin with, the court could well dismiss the case for lack of standing to sue on the part of any of the plaintiffs who brought the case. The state government plaintiffs barely pretend to have a colorable standing argument. The two individual plaintiffs complain that, though it is enforceable, the mandate nonetheless imposes a legal obligation to buy insurance, and they would feel uncomfortable violating that obligation. The problem with this is that Chief Justice Roberts, in his 2012 NFIB v. Sebelius decision, which upheld the mandate, expressly ruled that, and based his decision really on the determination that if individuals did not buy insurance, thus, quote, choosing to pay the penalty rather than obtain insurance, they will have fully complied with the law. Now, post-TCJA, the Tax Cut and Jobs Act, a non-purchaser will still not be in violation of the law simply because Congress reduced to zero the financial incentive to choose the purchase option. So no one is compelled to buy insurance in order to avoid a penalty, since none exists, nor to follow the law, because he will be following, or she will be following the law. So there's no injury period, no standing to sue. That's a very likely result, even in the Fifth Circuit, I would say. Okay, I'm sorry. Well, in addition, I would just say, on the merits, the ACA's mandate provision remains a valid exercise of the tax power. And that's pretty much for the same reason that there's no standing. And that is because Congress's determination after the original ACA passed to drop the penalty to zero did not strip Congress of its constitutional power under the tax authority. And nor can its subsequent determination sensibly mean that it was no longer using that power. And finally, I would just want to add really to what other people have said, and some of the members of the subcommittee have eloquently said, that to take the further leap that if the mandate provision is unconstitutional after the passage of after the reduction of the penalty to zero, which it really should not be found, but if it is, there's absolutely no basis whatsoever for for striking down the rest of the ACA.
All right, I'm going to, we've now concluded the statements of our witnesses. We thank you again for them. Each member will have 5 minutes to ask questions of the witnesses, and I'll start by recognizing myself for 5 minutes. I appreciate the discussion about the legalities, and of course we're discussing Texas versus the United States today. But the issue of pre-existing conditions keeps coming up. And I'd like Ms. Young and anyone else to chime in. This issue of what our Republican colleagues say that they are for, and I listen to C-SPAN a lot, and especially during the days running up to the election, and they covered Senate races and House races. And I heard Republicans over and over and over again in those debates with their opponents saying, I am for pre-existing conditions. Now, can anyone address how you extract that out of what we have now, the Affordable Care Act, and have standalone insurance policies? Where is the guarantee about what the price would be for that policy?
The Affordable
Would you like
Care Act, absolutely. Can you hear me okay? Great. The Affordable Care Act requires that all insurance plans charge consumers the same price regardless of
that. I understand. That's what we put in. But the minority is saying that they are for pre-existing conditions, except they have voted against the ACA countless times. So if you were to extract just that one issue and write a bill on it, where is the guarantee that what the price would be for that standalone policy?
In my view, it's very difficult to put together a system of protections for people with pre-existing conditions that doesn't include a panoply of reforms that looks similar to many of the reforms that were included in the Affordable Care Act. So you need to ensure people can buy a policy. You need to ensure that that policy doesn't exclude coverage for their particular healthcare needs. You need to ensure that they're able to purchase at a fair price. And you needed to surround that with reforms that really create a functioning insurance market by providing financial assistance, stable risk adjustment, and other associated provisions like that.
I want to get to something that is out there, and that is what I referred to in my opening statement. I referred to them as junk plans. And it's my understanding that many of these plans exclude coverage for prescription drugs, for mental health and substance use disorders. Who would like to address this? Is this correct?
I can address that.
Go ahead.
I believe you're referring to short-term limited duration coverage.
Right.
Those plans are not required to cover any particular benefits, and many of them can and likely will exclude coverage for benefits like prescription drugs, maternity care, substance use and mental health services, things like that.
Now, are these plans medically underwritten?
Many of them are, yes.
And how does that differ from the process by which Americans get health insurance on the individual market today?
Medical underwriting refers to a process where insurance companies require individuals to fill out a detailed health history questionnaire and then use the results of that to determine if the individual can purchase a policy, and if so, on what terms. That was a common practice in the individual market before the Affordable Care Act. It is permitted for short-term limited duration plans today. In contrast, in the ACA-compliant individual market, insurers are not prohibited to medically underwrite. Consumers sign up for a policy based only on information about their age and their income if they're seeking tax credits, with no health history screen.
I see.
Chairwoman Eshoo, you asked the rest of
Lazarus?
the panel, and we're getting a one-sided view of this. The ACA's protections are
I
not
didn't call on you. I'd like to call on Mr. Lazarus. Are you giving us comfort that the lawsuit is not going to go anywhere? Is that what you believe?
I think that all of the witnesses have basically said that, at least with respect to the notion that if the mandate provision is now found to be unconstitutional, which I don't think it will be or should be, the quantum leap that the Republican attorneys general and Judge O'Connor took to then say the whole law has to go, I don't think any member of the panel thinks that there is much chance of that occurring. I don't know whether that answers your. It doesn't mean, however, that the fact that there is this dagger pointed at the heart of our healthcare system is out there, causing uncertainty. That it was basically opponents of the ACA have outsourced to a judge, which Chairman Pallone correctly said was the target of forum shopping, who has a widespread reputation of, one article said, tossing out Democratic policies that Republican opponents
Thank
don't
you. I think
like.
my time is more than expired. Thank you. I now would like to recognize the ranking member of the subcommittee, Dr. Burgess.
Thank you for the recognition. Mr. Miller, let me just give you an opportunity. You were trying to respond with something about the ACA protections.
Sure, it's a complex issue, but we need to remember that in the best of worlds, the ACA left a lot of other folks unprotected. If you didn't comply with the individual mandate, you didn't get coverage. You got fined. You got insult on top of injury, and there's no coverage to it. So there are breakdowns in any imagined perfect system. There are other approaches which can also fill that hole. You're going to have to put some money in. You're going to have to resolve. I don't think the Republicans did a good job of it in 2017 in explaining and defining what that meant. They began backfilling as they went along with reinsurance. There are ways to extend HIPAA over to the individual market. Those are all thoughtful alternative approaches. And if you don't have an individual mandate, you should come up with something else. And we're not going to have an individual mandate. That appears to be the case. So you're leaving a hole there, and there are other ways to provide stronger incentives, and it requires some robust protections where if you went into something like a high-risk pool or an invisible risk pool, you could re-qualify for that full-scale portability after 18 months. So there are ways to connect the dots. It's heavier lifting and it's more work than just waving your arms and saying, we mandated it, it must work, even though it doesn't.
Thank you for that clarification. And just continuous coverage was part of the bill that we worked on 2 years ago.
The number of options, yeah.
Which, of course, is what exists in Medicare. I mean, if you do not purchase Medicare within 3 months of your 65th birthday, guess what? You get an assessment for the rest of your life that in the Part B of Medicare. So, Mr. Miller, I actually agree with you, and I guess other witnesses. My expectation is that this case will not be successful on appeal, and I base that on the fact that I have been wrong about every assumption I've made about the Affordable Care Act ever since its inception in 2009. So perhaps I can be wrong about that assumption, but I do assume that it will not survive on appeal. Let me just ask you, because I've had difficulty finding this information, and you may have some sense, how much money has been collected under the individual mandate? The fines that have been paid, do we have an idea what that dollar figure is?
Yeah, I did that a couple of years ago in the Ways and Means. I didn't know it was going to come up. I can supply it for you.
Great.
This is, with a bit of a lag, it ends up being calculated. Not a lot. And it's somewhat randomly distributed. It tends to be the lower income people who didn't know how to get out of the individual mandate who ended up paying it, surprisingly enough. But it did not amount to a large amount, and it didn't have a lot of coverage effects.
So basically, the effect of the Tax and Jobs Act of 2017 was current law because no one behaved as if it was a real thing anyway.
Well, it had some other ripple consequences, but in that, practical consequences were not as significant as is often said.
Well, let me ask you this. I mentioned in my opening statement that perhaps ways to end this lawsuit would be to either repeal the individual mandate outright or reestablish the tax within the individual mandate. Do you agree that either of those activities would...
That requires actual legislating, which is a hard thing to do these days on Capitol Hill.
Yes, sir, but it would achieve the goal of
Sure.
making the lawsuit.
And there's lots of other things. I mean, states could pass their own individual mandate. As I said, you could also just rescind your findings of fact in the old Congress and say, we were wrong, we're sorry.
Yeah, I don't think that's going to happen. Let me just ask you, I mentioned the phenomenon of silver loading in my opening statement. Would you walk us through, for people who are not familiar with that as a technical term,
Sure.
the phenomenon of silver loading?
It's a bit of a ripple of the other litigation over the cost-sharing reduction subsidies, and that's got a tangled web in itself. But cleverly, a number of states, insurance regulators and insurers figured out a way to game the system, which is how do you get bigger tax credits for insurance by increasing your premiums. There's also a worry about what those markets were doing, which fueled some of that increase. There's a lot of spikes in the individual market over the previous 2 years as a result of that. And the silver loading embellished that. Now, that was great for folks who were already covered, where because of the comprehensiveness of their subsidy income related, they weren't out any extra dollars as those premiums went up. But the folks in the rest of the individual market, and Ovik could talk to this as well, that's where we had our coverage losses, and that's where you got the damage being done. Those are the victims of the byproducts of doing good on one hand, and it spills over into other people.
That's the teacher and policeman that I referenced in my district who have 2 children. They're outside the subsidy window. Mr. Roy, could you just briefly comment on the effect of a Medicare for All policy on what union members receive as their health insurance?
Well, I mean, of course, there are many different definitions of Medicare for All, but if we define it as the elimination of private insurance, then obviously union members who have either Taft-Hartley-based plans or employer-sponsored insurance, that would be replaced by a public option or something like that. I assume that's what you mean.
Yes, sir. Thank you. Thank you for being here. I yield back.
Where are we going to? To recognize the gentlewoman from the great state of California and its capital, Sacramento, Ms. Matsui.
Thank you, Madam Chair. Thank you all for joining us today. The topic of this hearing is incredibly important to me and my constituents and all Americans whose lives have been changed by the Affordable Care Act. Special thank you to Ms. Hung for sharing your daughter's story and for your incredible advocacy work on behalf of children and families everywhere. When we started writing the ACA 9 years ago, I consulted with a full range of healthcare leaders in my district in Sacramento. We called together the hospitals, the health plans, the community health centers, the patients, and all those who contribute to our healthcare systems and all those who use it also. Everything was carefully constructed. We try to think about everything, but obviously you can't think of everything, but we consulted as widely as possible because we also knew that each policy would affect the next and the system as a whole. You simply cannot consider radical changes to the law in a vacuum, yet that is exactly what this ruling of the lawsuit does. By using the repeal of the individual mandate in the GOP tax bill as justification of this suit, the court has declared the entire Affordable Care Act invalid. Millions of Californians and Americans stand to lose critical health protections, including protections for people, especially with pre-existing conditions. Vital protections for Medicare beneficiaries, including expanded preventive services and closing the prescription drug donut hole, would be thrown into chaos. I was pleased to join my colleagues to vote for the House of Representatives to intervene in this lawsuit and defend the ACA, and I'll continue to fight to protect people with pre-existing conditions and for the health care of all Americans. And I think you know that that's something that all Americans care about when you think about pre-existing conditions. Everybody has some sort of pre-existing conditions. For me, the potential consequences of a lawsuit are too great to not fully consider, especially for the impact on people confronting mental illness and substance abuse. The passage of the ACA was a monumental step forward in our fight to confront the mental health and substance abuse crisis in this country and led to the largest coverage gains for the mental health in a generation through the expansion of Medicaid. Ms. Linkyung, can you briefly discuss why the consumer protections of the ACA are so important to individuals struggling with mental illness or substance abuse?
Absolutely. Pre-existing law that existed prior to 2009, established a baseline protection for people with mental illness that said that if their insurance plan covered mental illness, mental health needs, then it had to do so on the same terms that it covered their physical treatments. But it didn't require any insurance product to include coverage of mental health benefits, and so it was typical for coverage in the individual market to exclude mental health benefits completely. With the Affordable Care Act, plans were required to include coverage for mental health and substance use disorder services, and to do so at parity on the same terms as they include coverage for physical health benefits, and that brought mental health benefits to tens of millions of Americans, or about 10 million Americans who wouldn't have otherwise had it. In addition, the Medicaid expansion in the 37 states and DC that have taken that option has enabled many people with serious mental health needs, including substance use disorder, to access treatment that they would not otherwise have been able to access.
So this is be very serious. I'm thinking about the 37 states that did expand Medicaid. If this decision was upheld, I just really feel, frankly, that it's difficult enough when you have mental illness or someone in your family does, the stigma that is attached to it, whereas with this Medicaid expansion, I believe that most people will seek the treatment that they really need. And what do you foresee with the loss of this expansion if it were to happen?
If federal funding for Medicaid expansion was no longer available, then the states that have expansion in place would need to choose whether to find state funding to fill that gap, or to scale back their expansion, or cut benefits, or reduce provider rates, or some combination of those policies. The Congressional Budget Office and most experts expect that many states would retract the expansion and move those residents that were covered through expansion off the Medicaid rolls, and most of them are likely to become uninsured and would not continue to have access to mental health and substance use disorder coverage.
So in essence, we'll be going backwards then, once again. Okay. Thank you very much. I yield back the balance of my time.
Thank you, Ms. Matsui. I'd now like to recognize the gentleman from Kentucky, Mr. Guthrie.
Thank you very much, and again, congratulations on on being the chair. I enjoyed being vice chair last couple of times, and learned a lot about the healthcare system and moving forward. And I know today the title is, how does the Texas case affect pre-existing conditions? And I think we're hearing from everybody that it would probably near unanimous if we did a legislative fix to pre-existing conditions, regardless of where the case goes. And so I was listening to Dr. Burgess talk earlier about having a hearing for Medicare for all. And I think the chair of the full committee said that, well, why would you want to have a hearing for a piece of legislation to say you're not for? I think it's important for us to talk about and the issues that would come, because there are, I think, at least 4 or 5 presidential candidates that already say they're for it. So it's not just some obscure bill that somebody files every year. It's now gotten into the public space that we need to discuss. And Ms. Hung, I appreciate your testimony. I have nothing compared to your issues with your child, but I had a son that had some issues when he was a boy. He's 23 now, and so about a month of just what's going to happen. So I understand the pre-existing conditions. And then another year and a half, maybe 2 years in and out of children's hospitals. But we got the best words a parent can hear when a physician walks in. We know what the problem is now, and we can fix it. Matter of fact, just last fall, he thought he was having some problems, so he lives in Chicago. Rushed to Chicago, went to see to a doctor with him, and the doctor said, hey, it's something else. It's something routine we can treat. He goes, by the way, you had a really great surgeon when he was 8. So we were just reinforced with it. So everything kind of works. And so what is it kind of impressed me, and I guess I'm going to just talk a little bit instead of ask questions, but what's always impressed me about this, the care, Vanderbilt Children's Hospitals where we were, that he's received, and just the innovation our healthcare system is producing. It is absolutely amazing, the innovation coming out in our healthcare system. The artificial pancreas is real now. People can have it now. You can cure hepatitis C with a pill. It's just amazing what's happening. Some people, not a lot, it's not universal, but stage 4 melanoma has been cured with precision medicine. I mean, those things are happening in our healthcare system. They are expensive. And my biggest concern, if we go to a government run, that we just lose that healthcare. We innovate in the world, and President Trump talked about it a little last night, is living off our investment in innovation. But if we don't invest and innovate, who's going to do it, and who's going to have the care that we have? As a matter of fact, we're investing and innovating so quickly. This committee spent an awful lot of time over the last couple of years to put 21st century cures in place so the government regulatory structure can keep up with the vast investment. I know we spent a lot of time the last couple of years doing oversight. I hope we will continue to do oversight of the implementation of 21st century cures. So my only point is, and I'll yield back in just a couple of seconds, but is that it is important when we look at such massive changes to our healthcare system, the way people get at health insurance, and most people still get it through their employer. Is that going to go away? People get it through, we talked about the Indian Health Service. Is that going to go away? Is there a road to get rid of the VA? There's so much change that's proposed in what people boil down to a bumper sticker, Medicare for all, that it has implications for everybody. It has implications for the whole country. And universal coverage is a positive thing, but if you get to the if you get to the Medicare reimbursements throughout the entire healthcare system, I'm convinced we won't have the innovation that my son's completely healed, that had some innovative surgeries for his privacy, I won't say, but 15 years ago, that now would probably be completely different what you see. And my cousin is a NICU doctor, and the stuff that the babies that he now sees that are surviving. And we have a colleague here that had a daughter born without kidneys, who I guess Abby must be about 5 or 6 now. And so it's just, that's a concern. And I think that when we're going to have a piece of legislation that's kind of been boiled down to a bumper sticker, but it's going to have impact on everybody living in this country and everybody throughout the world, because I wish the world would help subsidize some of the innovations that we're producing, that it is worthy for us to have serious discussions and not just dismiss it as we're not being serious. So, and I can tell you, I know Dr. Burgess is, and I think the rest of the committee would be. And I appreciate you guys all being here and sharing your stories, but we can fix pre-existing conditions. I think we're all on board with that. So, and Madam Chair, I yield back.
I thank you, Mr. Burgess, always a gentleman. Let's see, who's next? The chairman of the full committee, Mr. Pallone.
Thank you. I wanted to ask Ms. Young a couple of questions, or really one question. On the day of the Texas District Court's ruling, President Trump immediately praised Judge O'Connor's decision to strike down protections for pre-existing conditions. The next day, he referred to the ruling as, quote, great news for America. And just last week, in an interview with the New York Times, President Trump boosted that the Texas lawsuit will terminate the ACA and referred to the ruling as a victory. In his testimony, Mr. Roy claims that President Trump supports protecting people with pre-existing conditions. I think that could not be further from the truth. The truth is, President Trump has sought to undermine and unravel protections for more than 130 million Americans living with pre-existing conditions, and understandably, that's not a record that Republicans want to promote. But I also want to remind folks that since this is not a fact that my colleagues on the other side seem to want to acknowledge, and that is that the Republican lawsuit brought by Republican attorneys general who asked the district court to strike down the entire ACA. So the fact that my colleagues and our minority witnesses today are trying to disassociate themselves from Judge O'Connor's ruling, which did exactly what the Republican AGs asked for, I think is quite extraordinary. Mr. Roy asserts in his written testimony that Congress should pass a simple bill reiterating guaranteed issue and community rating in the event that the district court's decision is upheld by the Supreme Court. So, and then we had this GOP bill or motion during the rules package where they said that they would do legislation that would only include guaranteed issue and community rating, and that would ensure sufficient protections for pre-existing conditions, whatever the courts decide. So basically, Ms. Young, I have one question. Can you explain why what Mr. Roy is asserting, that reinstating only these two provisions on guaranteed issue and community rating is insufficient to protect individuals of pre-existing condition? And the same, of course, is with the House GOP bill that would do that. Why is this not going to work to actually guarantee protection for individuals with pre-existing conditions?
The district court's opinion, as you note, struck down the entirety of the ACA. So not just its protections for people with pre-existing conditions, but the financial assistance available to buy marketplace coverage, funding for Medicaid expansion, a host of provisions in Medicare, protections in employer insurance, and associated reforms. So a standalone action that reinstated two pre-existing condition protections without wrapping that in the financial assistance and the risk adjustment and the Medicaid expansion and the other components of the ACA that are, in my view, important to make the system function, would not restore the system that we have today, where people with pre-existing conditions have access to a functioning market where they can buy coverage that meets their health needs. In fact, there have been some efforts by the Congressional Budget Office to score various proposals that keep some types of pre-existing condition protections in place, but eliminate the financial assistance. And the Congressional Budget Office, under some scenarios, actually find that those lead to even greater coverage losses than simply repealing the Affordable Care Act. So implementing those two provisions on their own without financial assistance and other protections would be insufficient.
I mean, I think this is so important because, again, Mr. Roy, and he's just reiterating what some of my Republican colleagues say, they just neglect all these other things that's so important for people with pre-existing condition. You didn't mention junk plans. I mean, my intuition tells me, and I'm not, I talk to people about it in my district, that if you start selling these junk plans that don't provide certain coverage, one of the things that's important for people with pre-existing conditions is to have a robust plan that provides coverage for a lot of things that didn't exist before the ACA. I mean, that's, again, important. The fact that you have a robust essential benefits package is also important for people with pre-existing conditions too, right?
Those are both critical protections. In particular, the ACA seeks to ensure that insurance for the healthy and insurance for the sick are part of a single combined risk pool. Efforts to promote short-term plans or other policies that don't comply with the ACA protections siphon healthy people out of the central market and drive up costs for those with pre-existing conditions and anyone else seeking coverage.
Yeah, so you're pointing out the very fact that you have a larger insurance pool, which has resulted from the ACA in itself is important for people with pre-existing conditions. And if you take out the healthier or the wealthier because you don't have a mandate anymore, that hurts them too, correct?
Efforts to move healthier people out of the individual market will increase premiums for those that remain in compliant coverage, yes.
All right. Thank you so much.
Thank you, Mr. Pallone. And now I want to recognize the ranking member of the full committee, Mr. Walden.
Thank you, Madam Chair. And I want to thank all of our witnesses. We have another hearing, important one, going on downstairs. That's why some of us are bouncing back and forth between climate change and health care. And I want to again say thank you for being here and reiterate that as Republicans, we believe strongly in providing pre-existing condition protection for all consumers. And if you go back to 1996, when HIPAA was passed under Republicans, we provided for continuous coverage protection for people with pre-X. I mean, this is something we believed in before ACA. It's something I believe in personally and deeply, and something that we're ready to legislate on. And I think at least giving that guarantee and certainty of people would make a huge level of comfort for them. And I just, you know, I know I didn't mean to shake things up this morning, but asking for a hearing on Medicare for All was something I thought was appropriate, given that other committees are already announcing their hearings. And that going back when ACA was shoved through here, and then Speaker Pelosi saying we had to pass it so you could find out what's in it. We don't want to repeat that. We need to know what's in it. We need thoughtful consideration. I think this committee's the place to have that. So I still think that's important. I want to thank both Tom and Avik for being here, Mr. Roy, and for being here on short notice. You said, Mr. Roy, that Congress should pass a simple standalone measure guaranteeing that insurers offer coverage in the individual health insurance market to anyone regardless of prior health status.
Yes, I did.
And do you want to respond? You didn't get a chance to kind of respond here. So do you want to respond to what was asked of the other witnesses around you?
Thank you, Mr. Walton. I appreciate the opportunity to actually explain my written testimony in this setting. The key here is that 3/4 of the variation of the premiums in health insurance in a fully underwritten market are associated with age, not health status or gender or anything else, pre-existing conditions. So the point is, if everybody of the same age, all 27-year-olds, all 50-year-olds, all 45-year-olds, if all 45-year-olds are charged the same premium, the variation in premiums between the healthy paying a little more and the sick paying a little less is not that big of a difference. It doesn't cause a lot of adverse selection. What drives adverse selection in the ACA is the fact that younger people are forced to pay effectively double or triple what they were paying before to allegedly subsidize the premiums for older people. So revising age bands would be a huge step in moving in the right direction. Reinsurance, which is effectively a high-risk pool within a single risk pool, would help basically also reduce the premiums that healthy people pay so that people with pre-existing conditions could get better coverage. So you can have a standalone bill that would ensure that people with pre-existing conditions have access to affordable coverage.
I would hope so. I think it's really important. I mean, we were for pre-existing protections. I was for getting rid of the insurance caps before ACA. I thought they were discriminatory against those who, through no fault of their own, had consequential health issues that could have blown through their lifetime caps. And so I think there are things we could still find common ground on. And I wonder if you want to address the Medicare for All proposal as well. Now, we haven't seen it spelled out. I know that budget committees, I guess, having it scored and hearings on it, but I'm concerned about the impacts it may have on delay in terms of getting health care. I'm concerned about what it might do to the Medicare Trust Fund. Do you want to opine on that while you're here?
Well, I've written a lot at Forbes and elsewhere about how Medicare for All, from a fiscal standpoint, is unworkable because of the gigantic transfers it would assign to the federal government. It would increase federal spending by somewhere between $28 and $33 trillion over a 10-year period, which would be an increase in overall federal spending of 71%. Now, that's not if that excludes the impact of cutting what you pay hospitals and doctors and drug companies by 50%, which is what you'd have to do to effectively make the numbers work. I do want to urge you, Mr. Walden, and your colleagues that while Medicare for All is unworkable, and I think most people know that, the status quo is unacceptable too. And I think it's extremely important for this committee in particular to tackle the high cost of hospital care, the high cost of drug prices.
That was, if I'd stayed on as chair, that was going to be our big priority this cycle. Surprise billing. I mean, you go in, you have a procedure, you play by all the rules, and it turns out the anesthesiologist put you under wasn't in your program, and you get billed. That's wrong. That's just right. We can find common ground on that one. We took on the issue of getting generic drugs into market, and under the change in law we passed last year, Dr. Gottlieb now has set a record for getting new generics in the market and driving both choice and innovation, but also price down. And this administration, I've been in the meetings with the president, with CEOs of the pharmaceutical companies. He's serious about getting costs down on drugs and getting to the middle part of this too. We need to look from one end to the other. Madam Chair, I think we can find common ground here to do that and get transparency, accountability, so consumers can have choice, and so we can drive down costs. I've used up my time, and I thank our witnesses again, and Madam Chair, I yield back.
I thank the ranking member. We plan to examine all of that, and I hope that we can find common ground on it, because these are issues that impact all of our constituents, and they need to be addressed. And on the surprise billing, I know that the Senate is trying to deal with it, and we should hear as well. I think that your clock is not working at the witness table.
That's correct.
But it's working up here. Okay, so maybe you can refer to that one. Now I'd like to call on the gentlewoman from Florida, Ms. Castor.
Thank you, Madam Chair. Witnesses, thank you very much for being here, and colleagues, thank you for all of your attention here. I just think it is so wrong for the Trump administration and Republicans in Congress to continue to try to rip affordable health coverage away from American families, especially our neighbors with pre-existing conditions. This lawsuit is just a continuation of their efforts to do that when they couldn't pass the bill here in the Congress, in the last Congress, despite Republican majorities. And I'm sorry to say that my home state of Florida, under Rick Scott's administration, joined that federal lawsuit. The 13 Democratic members of the Florida delegation have written to our new governor and attorney general asking, urging them to remove the state of Florida from the federal lawsuit that would kill the Affordable Care Act and rip health coverage away from American families, including individuals with pre-existing health conditions. This follows a letter we sent to Rick Scott as well. And I'd like to ask unanimous consent that these letters be admitted into the record of this hearing. American families they're simply tired of the assault on affordable health care. And Chairwoman Eshoo, you raised the point about the skimpy junk insurance plans, because one way that the Trump administration, Republicans are trying to undermine affordable care are these junk health plans that do not provide fundamental coverage. When you pay your hard-earned copayment and premiums, you should actually get a meaningful health insurance policy, not some skimpy plan that is just going to subject you to huge cost. These subpar and deceptive junk plans exclude coverage for pre-existing conditions. They discriminate based on age and health status and your gender. Consumers are tricked into buying these junk plans, mistakenly believing that they are the comprehensive ACA plan, but then they're faced with huge out-of-pocket costs. For example, in a recent Bloomberg article, Dawn Jones from Atlanta was enrolled in a short-term junk plan when she was diagnosed with breast cancer. Her insurer refused to pay for her cancer treatment, leaving her with a $400,000 bill. Another patient in Pennsylvania faced a $250,000 bill in unpaid medical bills because her junk short-term policy did not provide for prescription drug coverage and other basic services. The Trump administration now is actively promoting these junk plans, and I want American families and consumers across the country to be on alert. Don't buy into these false promises. Ms. Young, you've talked a little bit about this, but will you go deeper into this to help us educate families across the country? I understand that these plans often impose lifetime and annual limits. Is that correct?
It is, yes.
And that's something the Affordable Care Act outlawed.
Correct.
Can you describe what these plans typically look like and what kind of coverage they purport to provide?
Short-term limited duration insurance is not regulated at the federal level. None of the federal consumer protections apply. Some state law protections may apply or
Consumer
may not.
protections, name them.
the requirement that plans cover essential health benefits, the prohibition on annual and lifetime limits, the requirement that the insurance company impose a cap on the total copays and deductibles an individual can face over the year, requirements to cover preventive services, to not exclude coverage for pre-existing conditions and other.
Wait a minute. I've heard some of my Republican colleagues say they're all in favor of that. But can you be in favor of pre-existing condition protection on the one hand and then say, oh yeah, we believe that these junk insurance plans are the answer, like the Trump administration and Republicans in Congress are promoting?
Short-term limited duration plans do not have to comply with the requirements about pre-existing conditions. That's correct.
Can you describe why an individual who is healthy when they sign up for one of these junk plans could still be subject to hundreds of thousands of dollars in medical bills?
There's no requirement that short-term plans cover any particular healthcare cost. So an individual who doesn't read the fine print behind their policy might discover, for example, that the plan only covers hospital stays of a few days and individuals are on the hook for all additional hospital expenses. They may find that the plan has a very low annual limit, so that once they've spent $10,000 or $20,000, they are responsible for bearing the full costs. Or any variation like that where they simply discover when they need to access the healthcare system that the plan doesn't include the coverage that they had hoped to purchase.
Thank you very much. And we'll be working to ensure that consumers are protected, and when they pay their premiums and copays, they actually get a meaningful health insurance policy. Thank you, and I yield back.
Thank the gentlewoman. I'd now like to call on Mr. Griffith from Virginia. You're recognized for 5 minutes.
Thank you very much, Madam Chair. I appreciate it. Here's the dilemma that we have. In my district, which is financially stressed in many parts of it, I represent 29 jurisdictions in rural Southwest, always put the pause in there, Virginia. So when ACA came in, so many of my people immediately came to me, long before the Trump administration came in. And in their minds, the ACA was junk insurance. Because when they were promised that their premiums would go down, they now had premiums that were financially crippling. When they were promised that they would have better access, they now found that they had high deductibles. And they now found that their copays had gone through the roof. So there is no question, I've never argued, that the pre-existing condition was a problem that should have been dealt with long before the ACA. And I understand the concerns and the frustration that people had who had pre-existing conditions. And we need to take care of that, and we will take care of that. I don't see anybody who would argue at this point that we shouldn't deal with people with pre-existing conditions and make sure they have access to affordable health care, which is why I supported our attempts to get an amendment put in on day one of this Congress that would say get the committees of jurisdiction. In fact, it referenced the Energy and Commerce Committee, this committee, and the Ways and Means Committee to report out a bill that took care of all the concerns we've heard today and said it guarantees no American citizen can be denied health insurance coverage as the result of a previous illness or health status, and guarantees no American citizen can be charged higher premiums or cost sharing as the result of a previous illness or health status, thus ensuring affordable health coverage for those with pre-existing conditions. That's where we are. That's what we stand for. So, I find it interesting that this debate has become, I'm hearing about junk insurance and how, Republicans are evil, that they want junk insurance. I hear it on a regular basis that my people think that what they've got now is junk and it's all they can afford and it's costing them a fortune. So, Mr. Roy, what do you have to say about that?
I've found the conversation we've been having about so-called junk insurance interesting because nobody seems to be asking the question as to why people are voluntarily buying so-called junk insurance. They're buying it because the premiums are half or a third or a quarter of what the premiums are for
and
Affordable
if you
Care Act
can't
plans.
afford something else, you're going to buy something that you can't afford. Isn't that correct?
100%. So a plan that has all the bells and whistles but is unaffordable to you is effectively worthless, whereas a plan that may not have all the bells and whistles but at least provides you some coverage is. And the great tragedy of the Affordable Care Act is that we did not have to have that dichotomy. We could have had plans that had robust coverage for people with pre-existing conditions and protections for people regardless of health status, and yet we're still affordable. I've outlined it both in my written testimony, my oral testimony, and many, many other documents that I've presented to this committee in the past, how we could achieve that.
Now, you would agree with me, for those people who may have bought the junk insurance without knowing what they were getting into, that we probably ought to pass something that says that the things that aren't going to be covered, if you're only getting $20,000 worth of care, and then you have to take the full bill after that, as Ms. Castor talked about, we should have that in bold language on the front of the policy. You would agree that we should put some consumer protection in that, make sure there's transparency so people are well advised of what they're getting or not getting. Isn't that true?
I have no problem with robust disclosure about what's in a short-term limited duration plan versus an ACA-compliant plan. To a degree, we already have that, in the sense if you're buying off the ACA plan, I think most consumers know that those plans have fewer protections, but more disclosure and more clarity in disclosure would be a good thing.
Absolutely. I agree with that. You know, what's interesting is everybody seems to have gone after Judge O'Connor. I don't know him. I haven't studied his opinions. But I do find this interesting, and I thought it was the right thing to do. He put a stay on his ruling so it didn't create a national catastrophe or suddenly people having to scramble to figure out what to do. Mr. Miller, isn't that a little unusual in this day? When, I mean, people have accused him of being biased or having a political bent and using his power, but I seem to recall all kinds of opinions by judges that I thought were coming from a slightly different philosophical bent, but who went out there on a limb, pushed the envelope of the law, but instead of saying, now let's wait until the appeal's over and make sure this is right before we affect the average citizen, they just let it go into effect. But Judge O'Connor said, nope, in case this is overturned, I want to make sure nobody's adversely impacted and put a stay on his own ruling. Isn't that unusual, and wasn't that the right thing to do?
No, it's not. It's hopscotch. We've had some federal judges who have had nationwide injunctions reaching way beyond what you would think would be the normal process.
Yeah.
I think all the
I've
parties
noticed that.
understood what practically was going on here. I would just point out on the legalities of this, just to clean up the record.
Just summarize
things
very
about the
quickly because
My
your time's up.
Yeah. Okay, go ahead. If you could summarize, she said.
I'll just say
Quickly.
real fast, we left out the argument about tax guardrails, which is in Chief Justice Roberts' opinion, and Cy is exaggerating what is there and isn't there. The problem is that when you take it apart, there's nothing left behind. Because
Okay,
his test for
I
what's
think
in
your time's
tax
expired.
doesn't exist anymore. Okay.
And recognize Dr. Ruiz from California.
Thank you. It's so wonderful to be on this committee finally. So thank
He
you
hasn't
to all.
stopped celebrating.
Thank you to all the witnesses for joining us today. We have over 130 million Americans that have pre-existing conditions. The ACA defended full protections for people with pre-existing conditions, and those are three components. One is that insurance companies cannot deny insurance to people with pre-existing conditions. Two, they cannot deny coverage of specific treatments related to the pre-existing condition illness. And three, they cannot discriminate by increasing the prices towards people who have pre-existing condition. Let me give you some examples of some of the benefits and hardships that people would face if this lawsuit is completed. My district is home to Desert AIDS Project, an FQHC that was founded in 1984 to address the AIDS crisis. It is the Coachella Valley's primary nonprofit resource for individuals living with HIV/AIDS. They have grown to become one of the leading nonprofits in effective HIV/AIDS treatment in the nation. And the folks at Desert AIDS Project know how to end the HIV/AIDS epidemic. Basically, you need prevention and you need treatment. They told me that the ACA has been critical in providing treatment to the HIV in order to get the HIV viral load at an uninfectious low level. So the problems before the ACA was that insurance companies didn't used to have to pay for HIV tests, for example, or individuals with HIV couldn't get Medicaid coverage until they were really sick on full-blown AIDS, many already on their deathbeds. Now, because of the ACA, insurance companies must cover essential health benefits like HIV tests and antiviral medications, which, by the way, the folks on the other side have attempted to repeal Because of the ACA and the Medicaid expansion, many HIV-infected middle-class families now have health insurance for the very first time. Unfortunately, I can't say that for HIV patients throughout our country, including in states like Texas that didn't expand the Medicaid coverage. And by the way, this is another example of ACA that those on the other side have attempted to repeal. Before the passage of the ACA, 90% of Desert Age Project clients did not have health insurance. And now, with the ACA, 99.9% of clients have health insurance coverage in Desert Age Project. So let me repeat that statistic. Insurance coverage for these patients went from only 10% to 99.9% because of the ACA. And yet, the president, while claiming to be committed to eliminating the HIV/AIDS epidemic in 10 years, is actively taking measures to take away these protections of this very population by rolling back the Medicaid expansion and weakening and undermining pre-existing conditions protections. This would be devastating to Desert Age Project clients and patients, and yet this is just one example of the devastation that repeal of the ACA would cause on individuals with pre-existing conditions. Ms. Young, could you discuss the potential impact of a lawsuit on individuals with pre-existing conditions if the district court's decision is upheld?
If the district court decision were to be upheld as written, it would disrupt the coverage for people with pre-existing condition in all segments of the insurance market. So we've talked a lot about the individual market. The core protections in the individual market today would be eliminated, along with the financial assistance that enables them to afford coverage and makes those markets stable. In employer coverage, people with pre-existing conditions would also face the loss of certain protections. They would once again be exposed to lifetime or annual limits, and they could face unlimited copays and deductibles.
Let me get to another point, because we're hearing a lot of political trickery here in the conversations. A number of the folks on the other side have introduced bills that will pick and choose which one of these three components that make up full protections for pre-existing conditions that they want to have in certain bills. For example, one bill says we want guaranteed issue and community rating, which will help keep the cost low for everybody, but don't include the prohibition on pre-existing coverage exclusions. Another bill includes guaranteed issue and a ban on pre-existing coverage exclusion, but does not include the community rating, saying, well, let's charge people with pre-existing more than other folks. So they claim these bills are adequate to protect consumers with pre-existing conditions. Can you explain why these bills are inadequate to protect individuals with pre-existing conditions?
Very briefly, requiring insurance companies to sell a policy but allow pre-existing condition exclusions requires them to sell something, but it doesn't have to have anything in it. It's a little bit like selling a car without an engine. And allowing unlimited pre-existing condition rate-ups, it tells a consumer that they can buy a car, but they could be charged Tesla prices even if they're buying a Toyota Camry. That's not what the Affordable Care Act does. It puts in place a comprehensive series of protections.
Thank you.
Time has expired. I thank the gentleman. I now would like to recognize Dr. Bouchon from Indiana.
Thank you, and congratulations on your chairmanship. Look forward to working with you. I'm a physician. I was a heart surgeon before I was in Congress, and we all support protections for pre-existing conditions. Look, I had a couple of patients over the years who I did heart surgery on who one had had Hodgkin's disease in his 20s and his entire life. After that, he could not afford health coverage, and that's just plain wrong. We all know that. I had an employee of mine whose wife met her lifetime cap because of a serious heart condition and had to ultimately go on to Medicaid. That's not right. So I think Republicans have, for many years, have supported protecting people with pre-existing conditions. I think we're in a policy discussion about the most appropriate way to do that. And so I really think what we should be focusing on is to make sure that people actually have coverage that they can afford, quality, affordable health coverage. And under the ACA, as was previously described, the deductibles can be very high. You couldn't keep your doctor and your hospital, as everyone said that supported the ACA. And so we're not meeting that goal. And now we've heard from the Democrats about Medicare for all, And their bill in the last Congress, H.R. 676, would have made it illegal for private physician practices to participate in a government health care program. And by the way, Medicare for All doesn't even solve the main problem we have in health care, which is the huge cost. I keep telling people, if you continue to debate how to pay for a product that's too expensive, you're not going to catch up. It doesn't matter who's paying for it. It doesn't matter if the government's paying for it or a partial hybrid system like we have now. So I'm hoping we can have some hearings on how we get the cost down. And the insurance problem kind of almost can solve itself if we can do that. We should be talking about the fact that people with pre-existing conditions really don't have protections and doesn't work if you don't have actual access to a physician. So Mr. Miller and Mr. Roy, I'll start with Mr. Roy. Can you talk about what could happen in the U.S. if private physician practices were not allowed to participate in a single-payer program, hypothetically, and would that create access issues for patients?
Well, we already have access issues for patients in the Medicaid program. A lot of physicians don't accept Medicaid, even though they theoretically participate in the Medicaid program. That's also an increasing problem in Medicare because there are disparities in the reimbursement rates between private insurers, Medicare, and especially Medicaid. And this is one of the other flaws in the ACA, is that it relied on a program with very poor provider access to expand coverage. I think the exchanges, at least, have the virtue of using private insurers to expand coverage rather than the Medicaid program with its much lower reimbursement rates.
So I would argue that, then if you go to a Medicare for all, you have access issues on steroids potentially, and especially if you don't allow private practice physicians, what I'm saying, non-hospital or government-employed physicians, which is what we would all be, to participate in the program, which is actually not what other countries do. In England, for example, you can have your private practice and also participate in the National Health Service. Mr.
Going to Medicaid for all rather than Medicare for all. If
I think, can you turn on your mic, Mr. Miller? I think.
It looks like, oh,
there it is.
Right. You're more likely to have Medicaid for all than Medicare for all until you halt it and say, stop, we can't deal with that. The problem is we'd love to give away all kinds of stuff, we just don't want to pay for it. Now, we can shovel it off into ways in which you get less than what was promised and say, we've done our job. We did that to an extent with the ACA. You find the lowest cost way to make people think they're getting something that's less than what they actually receive. That's why the individual market as a whole has shrunk in recent years. It's because those people who are not well subsidized in the exchanges are finding out they can't afford coverage anymore.
So, and I'll stick with you, Mr. Miller. Do you think if the iteration of Medicare for all bans private practice physicians not to be able to participate, that we would put ourselves at risk of creating a two-tiered system where the haves can have private coverage and there can be private hospitals as there is in other countries?
Well, we've got plenty of tiers in our system to begin with. It would exacerbate those problems, and I don't think we would live with it politically, which is why we'd probably short circuit. But it's at least a danger when people believe in the theory of what seems easy, but the reality is very different.
Yeah, I'd have an ethical problem as a physician treating patients differently based on whether or not they are wealthy or whether or not they are subjected to a Medicare for all system, right? So ethically, I can tell you physicians would have a substantial problem with that. Other countries kind of do that because that's just the way it is there, and I think in many respects their citizens don't have a problem with it because that's just what they've always lived with. But I would agree with you that in the United States there would be some issues. Mr. Roy, do you have any comments on that?
I do. I would just like to add that at the Foundation for Research on Equal Opportunity, we put together a detailed proposal for private insurance for all, where everyone buys their own health insurance with robust protections for pre-existing conditions and health status and robust financial assistance for people who otherwise can't afford coverage in a way that is affordable, that would actually reduce federal spending by $10 trillion over 3 decades, but would ensure 12 million more people have access to health insurance than do today under current law. So there are ways to address the problem of affordability and access of health insurance while also reducing the underlying costs of coverage and care and making the fiscal system more sustainable.
Yeah, I think we should be also putting focus on the cost of the product itself, right? And the reasons why it costs so much are multifactorial. It's a free market system. The other thing is I told my local hospital administrators that if we get Medicare for all, get ready to have a federal office in your private hospital that tells you how to run your business. I yield back.
I thank the doctor, and last but not least, Mr. Rush from Illinois is recognized for 5 minutes for questioning.
Thank you, Madam Chair. Madam Chair, I also want to congratulate you for you becoming chair of this subcommittee. And
I thank you very much.
I have been a member of Congress for quite, as you have, for 26 years. This is my first time being a member of this subcommittee, and I am looking forward to working with you and other members of the subcommittee. I want to, as I look, recall when this Affordable Care Act was passed, there were millions of Americans who were without health insurance totally. They were uninsured. They had no help at all, no assistance from anyone to deal with their illnesses and their diseases. And since the act was passed, approximately 20 million Americans have gained health coverage, including over 1 million in my state, and I don't want to overlook that fact. I don't want to get that fact lost in other kind of in the minutiae of what of any one particular aspect of our discussion. In 2016, almost 14,000 of my constituents received health care subsidies to make their health care more affordable. And one aspect of the ACA that I like is insurance companies must now spend at least 80% of their premiums on actual health care, as opposed to other kinds of pay for CEOs and also to increase their profits. And the insurance rate has decreased between, non-insured rate rather, has decreased between the years 2013 and 2017. See 2017 in my state. Ms. Young, how many Americans would expect to lose coverage if this court decision in Texas were upheld?
The Congressional Budget Office has estimated that repeal of the Affordable Care Act against their 2016 baseline would result in 24 million additional uninsured Americans. And upholding the district court's decision, we could expect sort of broadly similar results, though with adjustments for the new baseline.
I want to ask Ms. Hong, you've been sitting here patiently, remarkably listening to a lot of discussion between experts, but how do you feel about your client, your daughter? How do you feel? What's your reaction to all of this as it relates to the looming problem that you have if this case is upheld?
Thank you. No one's going to sit here and say that they're not going to protect pre-existing conditions, right? No one's going to say that. But that's what we've seen. That's what families like mine have seen. Repeal efforts, proposals that don't cover pre-existing conditions, or claim to give a freedom of choice to choose what kind of insurance we want. Well, the choice that I want is insurance that covers, that guarantees that these protections are in place. I don't want to sit in the NICU at my daughter's bedside wondering if she's going to make it, and also then have to decide what kind of insurance I'm going to buy, and imagine what needs that she'll have in order to accommodate that. So I sit here and say, well, what worked for me is that I got to spend 169 days at my daughter's bedside without worrying about whether we would go bankrupt or lose our home. And that's the guarantee that we need.
Thank you, Madam Chair. I yield back.
Thank you.
I thank the gentleman. I now would like to call on another new member of the subcommittee, and we welcome her, Ms. Blunt Rochester from the small but great state of Delaware.
Thank you, Madam Chairwoman. First of all, thank you so much for your leadership. It is an honor for me to be on this subcommittee. And excuse me, I had competing committees for my first day of subcommittees. And so I've been running back and forth, but this is a very important topic. And I want to acknowledge Ms. Hung. The last time I saw you, we were at a press event with then Leader Pelosi, highlighting the little lobbyist and the work that you do and have been doing, and just your support of protecting pre-existing conditions for children across the country. And it's really admirable that you advocate not only for your child, but for all children across the country, and have been fighting for decades. And I was hoping that you could talk a little bit about the formation of the little lobbyists and who they are, what it's all about, how it formed.
Thank you, Congresswoman, and thank you for your support. Well, I did not set out to start the Little Lobbyists. It kind of just happened. We were following the news. Families like mine, families with children with complex medical needs and disabilities, were very concerned. We're very worried. And we decided to speak up and tell our stories. And I tell my story because I know that many have been fortunate to not experience the challenges and hardships that we've seen. I also know that many have not experienced the joy and gratitude that I've had in being Xiomara's mother. So I feel a responsibility to uplift these stories that we weren't seeing being represented. Now, I've spent more than my fair share of time in the hospital. I have witnessed my baby on the brink of life and death one too many times. I know what is possible with access to health care, with quality health care. And I think I can say that I have a profound understanding, more than many Americans, how fragile life is. And it is with that understanding that I have chosen to spend my time raising that awareness. I acknowledge my privilege. I acknowledge my proximity to Washington, D.C. to come here. There are so many stories like mine across the country of families who are just fighting for their children, who want to spend that time on their kids and not worrying about filing for bankruptcy or losing their home or wondering if they can afford life-saving medication.
Yeah, that was going to be my next question. How does this uncertainty affect your family? How is it affecting individuals that you work with and are talking to and other little lobbyists?
It's everything. It's everything. So the uncertainty is not knowing. I mean, we don't know what the future holds. None of us do. But to add this on top of what we're going through, on top of the NICU moms that I know that are worrying, who are trying to keep their jobs and trying to be there for their children, to add this level of uncertainty on top of it is just devastating.
I wanted to have your voice heard. I know from hearing that we have a lot of great experts and a great panel here, and I like to bring it back to what this is all about. Maybe, I don't know if I'm the last one speaking or the last, but I wanted to bring it back to why we're doing this and why we're here. I've served the state of Delaware in different capacities as our Deputy Secretary of Health and Social Services. I've been state personnel, so I've seen healthcare from that perspective, and also from an advocacy perspective as CEO of the Urban League. But hearing your story makes this real for us and is really one of the reasons why I wanted to be on this committee. So I thank you for your testimony. I thank the committee for your expert testimony, and I yield back the balance of my time.
Thank you very much. I don't see anyone else from the Republicans.
Some people coming back, but
okay.
Proceed.
All right, we'll move on. I now would like to recognize the gentleman from California, Mr. Cardin.
Thank you, and thank you, Chairwoman Eshoo and Ranking Member Burgess and all the staff for all the work that went into holding this hearing of this committee. And I appreciate all the effort that's gone into all of the attention that we're putting forth to healthcare, both at the staff level and at the member level, and certainly for the advocates in the community as well. Thank you so much for your diverse perspectives on what's important to the health and well-being of all Americans. I think while the legal arguments and implications of this case are important, I want to take a few minutes to focus on very personal threats posed by these attacks to the Affordable Care Act. This ruling, if upheld, would take away health care for tens of millions of Americans, including our most vulnerable, especially children and seniors. They're especially at risk, and people with pre-existing conditions, we would see them just be dropped from the ability to get health care. For some of this, this is literally a life and death situation, and as lawmakers, I hope that we don't lose sight of the fact of how critical this is, and as the lawmakers for this country, I hope that we can move expeditiously with making sure that we can figure out a way to not allow the courts to determine the future and the fate of millions of Americans when it comes to their health care and health care access. Also, I want to thank everybody who's here today, and also that the court's ruling would ideologically and politically, follow through with the motivation that I believe that close to 70 times or so in this Congress, there was an effort to end it, not mend it, when it comes to the Affordable Care Act, and I think it's inappropriate for us to look at it in such a black and white manner. There are cause and effects should the Affordable Care Act go away. I happen to be personally one of those individuals that through a portion of my childhood did not have true access to health care, and it's the kind of thing that no parent should go through, and it's the kind of situation that no American should ever have to contemplate waiting until that dire moment where you have to go to the emergency room instead of just looking forward to the opportunity to, sticking out your tongue and asking the doctor questions, and they ask you questions and they find out what is or is not wrong. And that's the kind of America that used to be. And since the Affordable Care Act, imperfect as it is, that is not the America of today. The America of today means that if a young child has asthma, that family can, in fact, find a way to get an equal policy of health care, just like their neighbor who doesn't have a family member with a pre-existing condition. So with that, I'd like to, with the short balance of my time, ask Ms. Hung, could you please expand on the uncertainty that you've already described that your family would face should this court decision end the Affordable Care Act as we know it? And then also, could you please share with us, are you speaking only for you and your family, or is this something that perhaps hundreds of thousands, if not more, American families would suffer that fate that you are describing?
Thank you. I'm here on behalf of many families like mine, the little obvious families, or families with
dozens or thousands?
Thousands across the country. Families with children with complex medical needs and disabilities. And these protections that we're talking about today, they're not just for these children, they're for everyone. They're for everybody. Any one of us could suddenly become sick or disabled with no notice whatsoever. Any one of us could go suddenly from healthy to unhealthy with no notice and have a pre-existing condition. An accident can happen, a cancer diagnosis, a sick child. There is no shame in being sick. There's no shame in being disabled. Let's not penalize that. There's no shame in Xiomara needing a ventilator to breathe or needing a wheelchair to go to the playground. But there is shame in allowing insurance companies to charge her more money just because of it, more for her care. And there's shame in allowing families like mine to file for bankruptcy because we can't afford to care for our children. It is that uncertainty that is being taken away or at risk right now. Our families are constantly thinking about that while we're at our children's bedside.
I just want to state with the balance of my time that this court case could be the most destructive thing that could have ever happened in American history when it comes to the life and well-being of American citizens. I yield back the balance of my time.
I thank the gentleman. I now would like to recognize my friend from Florida, Mr. Bilirakis.
Thank you, Madam Chair, and congratulations on chairing the best subcommittee in Congress. That's for sure. Most important.
Thank you.
Mr. Miller, the Texas court decision hinges on the individual mandate being reduced to 0 in the law. Can you explain the court's reasoning in their decision?
Well, I mean, we have to go back to a lot of convoluted reasoning in prior decisions in order to get there. So this is a legacy of trying to save the Affordable Care Act by any means possible, and it gets you into a little bit of a bizarre world. But if you take the previous opinions at their face, it was somewhat of a majority of one by Chief Justice Roberts, he basically saved the ACA, which otherwise would have gone down before any of this was implemented, by having a construction which said, I found out it's a tax after all. And he had 3 elements as to what that tax was. The problem is, once you put the percentage at 0 and the dollar amount at 0, it's not a tax anymore. It's not bringing in revenue. You don't pay for it in the year you file your taxes. It's not calculated the way taxes are. So that previous construction, if you just look in a literal way at the law, doesn't hold anymore. What we do about it is another issue beyond that. But on the merits, we've got a constitutional problem, and in that sense, that court decision was accurate. People then say, where do you go next? And that's the mess we're in.
Yeah. Could legislation be passed that would address the court's concerns, such as reimposing the individual mandate?
All kinds of legislation. You're open for business every day, but sometimes business doesn't get conducted successfully. There are a wide range of things that I can imagine, and you can imagine, that would deal with this. In either direction, you have to pass something. What we're doing is we're passing the buck. We're trying to uphold some odd contraption, which is the only one we've got, as opposed to taking some new votes and saying, what are you in favor of and what are you against, and be accountable for it and build a better system.
Thank you. Mr. Roy, you've written extensively on how to build a better health care system. The goal of the individual mandate, when the Democrats, now the majority party, passed the ACA, was to create a penalty to really force people to buy insurance. Are there alternative ways to provide high-quality insurance and low prices without a punitive individual mandate?
Absolutely. So as we've discussed already, and I know you haven't necessarily been here for some of that discussion, simply the fact that there's a limited open enrollment period in the ACA prevents the gaming of jumping in and out of the system, and that's a standard practice in employer-based insurance. It's a standard practice in the private sector parts of Medicare. That's a key element. Another key element is to reform the age bands, the 3-to-1 age bands in the ACA, because that actually is the primary driver of healthy and particularly younger people dropping out of the market. Another key piece is to actually lower, of course, the underlying cost of health care so that premiums will go down, and making sure that the structure of the financial assistance that you provide to lower income people actually matches up with the premium costs that are affordable to them. And a big part of it is, again, making the insurance product a little bit more flexible so plans have the room to innovate and make insurance coverage less expensive than it is today.
All right, thank you very much. I yield back, Madam Chair, the rest of my time.
Thank you, Mr. Bilirakis. I now would like to recognize the gentleman from Oregon, Mr. Schrader.
Thank you, Madam Chair. I appreciate that. I think sometimes we forget that the ACA was a response to a bipartisan concern about the construction of the healthcare marketplace prior to the ACA. It was pretty universal opinion, not a partisan issue, that healthcare costs were completely out of control, whether you were upper middle class or low income or extremely wealthy. It was unsustainable. And the ACA may not be perfect, but as pointed out at the hearings, it gave millions of Americans health care that didn't have it before. It started to begin the discussion that we're talking about here of how do you create universal access in an affordable way to every American. Certainly, I'm one of the folks that believe health care is a right, not a privilege, in the greatest country in the world. We are discussing about different ways to get at it. I think one of the most important things that doesn't get talked about a lot is the importance of the essential health benefits. It gets demonized because, well, geez, I'm not a woman, so I shouldn't have to pay for maternity. You know, I'm invincible. I'm never really going to get sick, so I don't need to pay for, you know, emergency health care. Those things are ancillary. I guess, Ms. Young, talk to us a little bit about why the essential health benefits are part of the Affordable Care Act. And there have been some attempts by the administration and different members not, I think, realizing how important they are with these often, you know, cheaper plans. Just get the cost down. They're ignoring maybe the health aspects of that. Could you talk a little bit about that?
Absolutely. Prior to the Affordable Care Act, insurers could choose what benefits they were going to place in their benefit policies. The Affordable Care Act's essential health benefit requirements require that all insurers in the individual and small group markets cover a core set of 10 benefits. Things like hospitalizations and doctor's visits, as well as maternity care, mental health and substance use disorder, prescription drugs, outpatient services. So really ensuring that the insurance that people are buying offers a robust set of benefits that provides them meaningful protection if they get sick. If you return to a universe where an issuer can choose what benefits they are going to put inside of a policy, you could have an insurance benefit that, for example, excludes coverage for cancer services, and another policy that excludes coverage for mental health needs, and one that excludes coverage for a
And that might be in the
particular kind
fine
of drug.
print, and people may not realize that as they sign up for policies.
That's correct, yes. So it would require consumers to really pile through the insurance, different policies to understand what they were buying. It also provides a backdoor path to underwriting, because insurers, for example, that exclude coverage for cancer from their benefit won't attract any consumers who have a history of cancer or who have reason to believe that they may need cancer coverage. And so it really takes our insurance market from one that successfully pools together the healthy and the sick to one that becomes more fragmented.
Right. Well, and another piece of the Affordable Care Act that gets overlooked, and again, it's been alluded to by different members and some of you on the panel, is the innovation, the flexibility. I mean, the Center for Medical Innovation, the accountable care organizations. Instead of, it seems to me we're focused just on cost. How do I itemize this cost? We asked you guys these questions, the rate bands and all that stuff. We should be concerned about health care. I mean, the goal here is to provide better health. It's not to support the insurance industry or my veterinary office or whoever. The goal is to provide better health care. And the way you do that is by, I think, having the experts in different communities figure out what's the best healthcare delivery system. Do you need more dentists in one community? Do you need more mental health experts in another community? I'm very concerned that if the Affordable Care Act is undone, that a lot of this innovation that's been spawned, the accountable care organizations that are going, would begin to dissolve. There'd be no framework for them to operate in. Just recently in Oregon, where I come from, we had a record number of organizations step up to participate in what we call our coordinated care organizations to deal with the Medicaid population, and have over 24 different organizations vying for that book of business. Could you talk just real briefly, I'm sorry, time-wise, real briefly about what would happen if those all went away?
As you note, the Affordable Care Act introduced a number of reforms in how Medicare pays to incentivize more value-based and coordinated care. If the district court's decision were to be upheld, then the legislative basis for some of those programs would disappear, and there would really be chaos in Medicare payment if that decision were upheld.
Too. Yeah. Thank you, and I yield back, Madam Chair.
To thank the gentleman. I can't help but think that this was a very important exchange, and your expressed viewpoints and counterpoint to Mr. Miller's description of the ACA as a odd contraption. I now would like to. On that if I had the opportunity. Yeah, I'm sure you would. Let's see, who's next? Now would like to recognize Mr. Carter from Georgia.
Well, thank you, and thank all of you for being here. Very, very interesting subject matter that we have as our first hearing of the year. I find it very interesting. Mr. Miller, let me ask you, just to reiterate and make sure I understand, I'm not a lawyer, I'm a pharmacist. So I don't.
Good for you.
Yeah, I don't know much about law or lawyers. And
it's a dangerous weapon.
Well, let me ask you something. Right now, this court case, how many patients is it impacting?
Well, people hypothetically might react thinking it's real, but otherwise nobody.
But it's my understanding it's still in litigation.
Correct. And it's going to take a while, and it's going to end up differently than where it starts. But we're doing this, make-believe, because it'll score some points.
Make-believe, I mean, we're in Congress. We're not supposed to be make-believe. I mean,
well,
I'm trying to understand why this is the first hearing. And when it's not impacting a single patient at this time, it's still in litigation. We don't know how it's going to turn out. We don't know how long it's going to take. Judging by other court cases that we've seen, it may take a long, long time.
Well, to be fair, I used to run hearings in Congress on staff.
Well,
majority can run any kind of hearing it wants to.
We're not here to be fair. So anyway, I'm trying to figure out why this is the first hearing. I mean, earlier the chairman of the full committee berates our Republican leader and because he asked for a hearing on something that he's opposed to and that I'm opposed to, and I'm just trying to figure it out. One of the things that we do agree on is that pre-existing conditions need to be covered. Isn't it possible for us to still be working on pre-existing conditions now and legislating pre-existing conditions while this is under litigation?
Well, you need our majorities who are willing to either spend money, change rules, and move things around. But that's been hard for Congress to do.
Well, I think that the record would show that, the first one of the first bills that we proposed in the Republican Party was in a Republican conference was for pre-existing conditions. Chairman Walden, in fact, I know he did because I co-sponsored it.
Yeah, it was one of the more thorough ones.
Actually, we have concentrated on that. So thank you for that. I just want to make sure, Mr. Roy, I want to ask you: Did you testify before the Oversight Committee recently?
Last week, yes.
What were they talking about in the Oversight Committee? What were you testifying about?
Prescription drug prices, the high cost of prescription drugs.
Go figure. Here we are in the committee, in the subcommittee, with the most jurisdiction over health care issues, and Oversight has already addressed prescription drug pricing?
Well, you have 2 years in this committee, and I look forward to hopefully being invited to talk about
I do too. I'm just baffled by the fact that, drug pricing is one of the issues, is the issue that most citizens, when polled, identify as being something that Congress needs to be acting on. And I'm just trying to figure out, and Oversight, they've already addressed it.
One thing I will say about this topic, Mr. Carter, is that it's one of the real opportunities for bipartisan policy in this Congress. We have a Republican administration and a Democratic House where there's been a lot of interest in reducing the cost of prescription drugs, and I'm optimistic that we really have an opportunity here to get legislation
And I
through
thank
Congress.
you for bringing that up, because Representative Schrader and I have already co-sponsored a bill to stop what I think is the gaming of the system of the generic manufacturers and the brand name manufacturers, of what they're doing and delaying generic products to get onto the market. So, Madam Chair, I'm just wondering, when are we going to have...
Would the gentleman yield?
And if I could ask a question, when are we going to have a hearing on prescription drug prices?
I can't give you the date, but it is one of the top priorities of the majority. It's one of the issues that we ran on with the promise to lower prescription drug prices. I believe that there is a bipartisan appetite for this, and we will have hearings and we will address it.
Reclaiming my time, I appreciate that very much, Madam Chair, because it is a pressing issue, and it is an issue that needs to be addressed now and today, unlike what we're discussing here today that's not impacting one single person at this point. So, with all due respect, Madam Chair, I hope that we can get to prescription drug pricing ASAP, because it is something that we need to be, and that we are working on. And Mr. Roy, you could not be more correct. This is a bipartisan issue. I practiced pharmacy for over 30 years. Never did I once see someone say, oh, this is a price for the Democrat, this is a price for the Republican, this is a price for this person and that person. It was always the same. It was always high. That's why we need to be addressing this. So I thank you for being here, and I thank all of you for being here. And, Madam Chair, I yield back.
thank the gentleman. I now would like to recognize new member of the subcommittee, Ms. Barragan from California. Welcome.
Thank you, Ms. Chairwoman. My friend from Georgia asked why we're having this as the first hearing, and I just have to say something because, you know, I'm in my second term, and in my first term, when the Republicans were in the majority, they spent all of their time trying to take away health care coverage for millions of Americans. They talk about pre-existing conditions and talk about saving people with pre-existing conditions, but this very lawsuit is going to put those people at stake. So why are we having this hearing? Well, because you guys have been working to take away these coverages, and we're trying to highlight the importance of this lawsuit. Now, you had 2 years. And yes, you could have started with prescription drug prices and reducing those, and that wasn't done. So you're darn right the Democrats are going to take it up. You're darn right that we're going to have hearings on this. And I'm proud to say that our chairwoman and our chairman have been working hard at making sure we are going to work to bring down prescription drug prices. But the hypocrisy that I hear on the other side of the aisle can't just go just completely unanswered and silenced. So with that said, I'm going to move on to what my comments have been. I want to thank you all for your testimony here today. It's been really helpful to hear us understand the potentially devastating impact of this lawsuit and of the district court's decision. The court's decision would not only eliminate protections for pre-existing conditions, but would also adversely impact the Medicaid program and end the Medicaid expansion. Now, the Affordable Care Act's expansion of Medicaid filled a major gap in insurance coverage and resulted in 13 million more Americans having access to care. I represent a district that's a majority minority, about 88% black and brown people of color. And, you know, black and brown Americans still have some of the highest uninsured rates in the country. Both groups have seen their uninsured numbers fall dramatically with the ACA. You know, between 2013 and 2016, more than 4 million Latinos and 1.9 million blacks have secured affordable health coverage. Ultimately, black and brown Americans have benefited the most from the ACA's Medicaid expansion program. Ms. Young, I would like to ask, can you briefly summarize the impact of the lawsuit on Medicaid beneficiaries and in particular the expansion population?
Medicaid expansion is, as you note, a very important part of the Affordable Care Act's coverage expansion, and it is benefiting millions of people in the 37 states that have expanded or in the process of expanding this year. Medicaid expansion has been associated with better financial security, and failure to expand is associated with higher rates of rural hospital closures and other difficult impacts in communities. If this decision were to be upheld, then the federal funding for Medicaid expansion would no longer be provided, and states would only be able to receive their normal match rate for covering the population that is currently covered through expansion. That's an impact of billions of dollars across the country and a very large impact in individual states. States will have the choice between somehow finding state money to make up that gap, or ending the expansion and removing those people from the Medicaid rules, or potentially cutting provider rates, or making other changes in the benefit package, or some combination. So you're looking at a potentially very significant losses of coverage in that group, as well as an additional squeeze on providers.
Thank you. Ms. Hung, how has Medicaid helped your family afford treatment? And why is Medicaid and Medicaid expansion so important for children with complex medical needs and their families?
Medicaid is a life-saving program. I say this without exaggeration. Medicaid is the difference between life and death. It covers what health insurance doesn't cover for a lot of children with complex medical needs. Notably, it covers long-term services and supports, including home and community-based services that enable children's independence. For a lot of families who do have health insurance, like mine, health insurance doesn't really cover certain DME, durable medical equipment, certain specialists, the ability to go out of state. And so that's the difference for a lot of our families.
Great. Well, thank you all. I yield back.
Thank you very much. Now, the patient gentleman from Montana, Mr. Gianforte.
Thank you, Madam Chair, and thank you to the panelists for your testimony today. Every day, I hear from Montanans who ask me why their health care costs keep going up and continue to increase while their coverage seems to shrink at the same time. While we look for long-term solutions to make health care costs more affordable and accessible, I remain firmly committed to protecting those with pre-existing conditions. In fact, I don't know anyone on this committee, Republican or Democrat, who doesn't want to protect patients with pre-existing conditions. Ensuring Americans with pre-existing conditions can keep their health insurance and access care is not controversial. It shouldn't be. We all agree on it. Which brings us to today. In the ruling in Texas versus Azar, it has not ended Obamacare. It hasn't stripped coverage of pre-existing conditions, and it hasn't impacted 2019 premiums. While we sit here today talking about it, the Speaker has moved to intervene in the case, and the judge's ruling has been appealed. The case is working itself through the courts. We could have settled this with a legislative solution less than a month ago. One of the earliest votes we took in this Congress was to lock in protection for patients with pre-existing conditions. Unfortunately, Democrats rejected that measure. And yet here we are in full political theater talking about something we all agree on, protecting Americans with pre-existing conditions. We should be focused instead on the rising cost of prescription drugs, telehealth, rural access to health care, and other measures to make health care more affordable and accessible. I hope this committee will hold hearings and take action on these issues important to hardworking Montanans. I can understand, however, why my friends on the other side of the aisle do not want to take that path. Some of their party's rising stars and other jockeying for Democratic nomination in 2020 have said we should do away with private insurance. They advocate for a so-called Medicare for all. In reality, Medicare for none. Their plan would gut Medicare, end the VA as we know it, and force 225,000 Montanan seniors who rely on Medicare to the back of the line. Montana seniors have earned these benefits, and lawmakers shouldn't undermine Medicare and threaten health care coverage for Montana seniors. Since we all agree we should protect patients with pre-existing conditions, let's discuss our different ideas for making health care more affordable and accessible. We should put forward our ideas. On the one hand, Medicare for all, a government-run, single-payer health care system that ends employer-sponsored health plans. On the other, a health insurance system that protects patients with pre-existing conditions, increases transparency, choice, and preserves rural access to care and lowers costs. I look forward to a constructive conversation about our diverging approaches to fixing our health care system. In the meantime, I'd like to direct a question to Mr. Miller, if I could. Under Medicare for All, Mr. Miller, do you envision access to care would be affected for seniors and those with pre-existing conditions in rural areas in particular?
Well, that's a particular aspect. I think in general, the world that seniors are currently used to would be downgraded. You're spreading the money a little wider and thinner in order to help some. This is the story of the ACA. We can create winners, but we'll also create losers. Now, the politics as to who you favor sort out differently in different folks. It's hard to get a balancing act where everybody comes out on top unless you make some harder decisions, which is to set priorities and understand where you need to subsidize and what you need to do to improve care and the health of people before they get sick.
So it's your belief that if this Congress were to adopt a Medicare for all approach, seniors would be disadvantaged. It would be more difficult to access care.
They would be the first to be disadvantaged, as well as those with employer-based coverage, because if you swallowed it whole, I mean, there are lots of other problems Ovik mentioned, not just the spending. It's actually the inefficiency of the tax extraction cost. When you run that much money through the government, you don't get what you think comes out of it.
One other topic quickly, if I could. Telehealth is very important in rural areas. It's really vital to patients in Montana. How do you foresee telehealth services being affected under a single-payer system?
Well, Medicare has probably not been in the forefront of promoting telehealth. I think there's a lot more buzz about telehealth as a way to break down geographical barriers to care, to have more competitive markets. And so, if past history is any guide of Medicare fee-for-service, it's not as welcoming to telehealth as private insurance would be.
Okay, and I yield back.
I thank the gentleman. I now would like to recognize the gentleman from Vermont, Mr. Welch.
Thank you. I'll be brief, but just a few comments. I think it is important that we had this hearing. This did not come out of thin air. I mean, I was on the committee when we wrote the Affordable Care Act. Very contentious. It was a party line vote. I was on the committee when we repealed it. This committee repealed the Affordable Care Act. And we never saw a bill, we never had a hearing. And now we have a continuation of this effort by the Republican attorneys general to attack it. And we have the unusual decision by the administration where instead of defending a federal law, they're opposing a federal law. So it's why I've been continuing to get so many letters from Vermonters who are fearful that this access to health care that they have is really in jeopardy. Loretta Himbecker from Montgomery has a 21-year-old son who's making $11.50 an hour. He's got a medical condition from birth, and absent the access to health care, he wouldn't be able to work, and the mother would probably be broke. I've got a cancer patient, Kathleen Voigt-Walsh from Jericho. Would not have access to the treatment she needs absent this. I mean, Ms. Hung, you really, in your own personal presentation, have explained why people who really need it would be scared if we lost it. And I also served in Congress when the essential agenda on the Republican side was to try to repeal it. I mean, it was a pretty weird place to be, Congress, when on a Friday afternoon, if there was nothing else to do, we'd put a bill on the floor to repeal health care for the 60th time. I mean, we're just banging our head against the wall. Thank you for having this hearing, because I see it as a reassurance to a lot of people I represent that we mean business, that we're going to defend what we have. Now, second, on some of the criticisms about this not being a hearing on prescription drugs, Mr. Roy, you were in and did a great job helping us start the process in oversight and government reform. But I know our chair of this subcommittee, this is the committee where there's actual jurisdiction, is totally committed to pursuing this. And I thank our chair. And I've been hearing very good things from President Trump about the need to do this. So my hope is that we're going to get a lot of Republican support to do practical things so we're not getting ripped off, as the president has said, by us paying the whole cost of research. A lot of it, by the way, from taxpayers, not necessarily from the companies, and have to pay the highest prices. So I'm commenting and not asking questions, but I know that there has been extensive and excellent testimony. But I just want to say to the chair, and I want to say to my colleagues, Republican and Democrat, if the net effect of this hearing is that we're affirming a bipartisan commitment not to mess with the Affordable Care Act, then I'm going to be able to reassure my constituents that their health care is safe. And if the criticism is essentially we've got to do more, we're ready to do more, right? Madam Chair, so I thank you for this hearing, and I thank the witnesses for their excellent testimony, and look forward to more down the line.
Thank the gentleman for his comments and his enrichment of the work at this subcommittee. I think it's important to know that on the note that on the very first day of this Congress, that House Democrats voted to intervene in this case. The very first day of the Congress, as it moves through appeal. So we're the ones that are representing the government. And I think that for my colleagues on the other side of the aisle, you may not like my suggestion, but if you're for all of these things that you're talking about, right to the attorneys general and the governors that brought the suit and say, we want it called off. We want to move on and strengthen the healthcare system in our country. You'll find a partner in every single person on this side of the aisle. With that, I'd like to recognize Mr. O'Halloran. What state? Arizona. The great state of Arizona, who is, I believe, waving on to the subcommittee. And we have a wonderful rule in the full committee that if you're not a member of a subcommittee, you can still come and participate, but you're the last one to be called on. So thank you for your patience, and thank you for caring and showing up.
Thank you, Madam Chair. I'm also usually last at my house also to be called on. Thank you, Madam Chair. Although I am not a permanent member of the subcommittee, I appreciate your invitation for me to join you today to discuss this issue that is so critical to families across Arizona, and thank you to the witnesses. As some of you know, the district I represent is extremely large and diverse. You know, the size of Pennsylvania. 12 federally recognized tribes are in my district. Since I came to Congress 2 years ago, I've been focused on working across the aisle to solve health care issues. We face these issues together because it's one thing that I hear about every single corner of my rural district and one of the overriding issues in Congress. A district where hospitals and the jobs they provide are barely hanging on, and where decades of toxic legacy of uranium mining has left thousands with exposure-related cancers across Indian country. A district where Medicaid expansion made the difference for some veterans getting coverage, some hospitals keeping their doors open, where essential health benefits meant some struggling with opiate addiction could finally get substance abuse and treatment. I'm here because the lawsuit we are discussing today isn't about any of those policies and how they save taxpayer dollars and protect rural jobs. I'm a former Republican state legislator. I know that this lawsuit is purely motivated not by what's best for the people we are representing, but by politics. Ms. Young, I have 3 questions for you. The first is, the first letter I ever sent to as a member of Congress was a bipartisan letter to congressional leadership about dangers of ACA repeal on the Indian Health Care Improvement Act, which was included in the ACA. Madam Chair, I ask unanimous consent to enter my letter into the record.
So ordered.
Ms. Young, can you describe what the fate of this law would be if this lawsuit succeeds and what it means for tribal communities?
The district court's opinion, as written, struck down the entire Affordable Care Act, so it would even unrelated provisions like the Indian Health Care Improvement Act. So if the decision were upheld, then the Indian Health Care Improvement Act would no longer have the force of law, and the improvements included in that law, like better integration with the Veterans Health Service and better integration of behavioral health and other core benefits for the Indian Health Service would be eliminated.
Thank you, Ms. Young. Are cancers caused by uranium exposure considered a pre-existing condition?
I suspect that under most medical underwriting screens they would be, yes.
Thank you. And Ms. Young, over 120 rural hospitals have closed since 2005. Right now, 673 additional facilities are vulnerable and could have closed. That's more than a third of rural hospitals in the United States. If this lawsuit succeeds, do you anticipate rural hospitals and the jobs they provide would be endangered as a result of fewer people having health coverage?
As you know, rural hospitals face a number of challenges and a number of difficult pressures. There has been research demonstrating that a state's failure to expand Medicaid is associated with higher rates of rural hospital closures. And so if funding for the federal funding for Medicaid expansion were removed, then it is likely that that would place additional stress on rural hospitals.
Thank you. Madam Chair, this is why last year I led the fight to urge my state's Attorney General to drop this partisan lawsuit. So much is at stake in Arizona for veterans, the tribes, for jobs in rural communities like mine. I'm interested in finding bipartisan solutions to the problems we've got, and I'll work with anyone here to do that. But this lawsuit doesn't take us in that direction. It takes us back, and my district can't afford that. Thank you, and I yield back.
I thank the gentleman for making the time to be here and to not only make his statement, but ask the excellent questions that you have. At this time, I want to remind members that pursuant to the committee rules, they have 10 business days to submit additional information or questions for the record to be answered. Yes?
Can I seek recognition for unanimous consent request?
Sure, just a minute. Let me just finish this, all right? I want to remind members that pursuant to committee rules, the members have 10 business days to submit additional questions for the record to be answered by the witnesses who have appeared, and I ask each of the witnesses to respond promptly to any such questions, and I see your heads nodding, so I'm comforted that by that, these questions that you may receive. And I would recognize the ranking member, and I also have a list of to request a unanimous consent for the record. Okay. The first is statement for the record from the American Cancer Society, Cancer Action Network, and 33 other patient and consumer advocacy organizations. Statement for the record from the American Academy of Family Physicians. A statement for the record from the American College of Physicians. The Wall Street Journal editorial, Texas Obamacare, entitled Texas Obamacare Blunder. I think that was referenced by Mr. Lazarus earlier today. Jonathan Adler and Abby Gluck, New York Times op-ed entitled What the Lawless Obamacare Ruling Means. A brief of the amicus curiae from the American Medical Association, the American Academy of Family Physicians, the American College of Physicians, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry. Isn't it extraordinary what we have in this country? Just the listing of these organizations. The USA Community Catalyst, the National Health Law Program, Center for Public Policy Priorities, and Center on Budget and Policy Priorities. The brief of the amici curiae from the American Cancer Society, the Cancer Action Network, the American Diabetes Association, the American Heart Association, the American Lung Association, and National Multiple Sclerosis Society supporting defendants, and a statement for the record from America's Health Insurance Plans. So I'm asking a unanimous consent request to enter the following items in the record. I hear no objections, and I will recognize the ranking member.
Thank you. First off, thank you for reminding me why I have not yet paid my AMA dues this year. I have a unanimous consent request. I would ask unanimous consent to place into the record the letter that was sent by Mr. Walden and myself regarding the Medicare for All hearing.
No objection. The only request that I would make is that maybe on your email mailing list, that when you notify the chairman of the full committee, that maybe my office can be notified as well.
Welcome to the world that I inhabited 2 years ago.
That's right. I think you'll understand.
I never found out until after the fact.
Right,
but,
right.
I would take that up with your full committee chair. I'm sure they will recognize the importance of including you in the email distribution.
I thank the gentleman. Let me just thank the witnesses. You've been here for almost 3 hours. We thank you for not only traveling to be here, but for the work that you do that brings you here as witnesses. Mr. Lazarus says he's retired, but he brings with him decades of experience. We appreciate it. To each witness, whether you are a majority or a minority witness, we thank you, and do get a prompt reply to the questions, because members really benefit for that. So our collective thanks to you, and to Ms. Hung. What a beautiful mother. You brought it all. I'm glad that you're sitting in the center of the table. because you centered it all with your comments. So with that, I will adjourn the subcommittee's hearing today. Thank you.